I myself, Dr. Jahapriya. We'll be discussing the entire microbiology in this order. So I'm going to start with general microbiology. In this, the important questions will be asked from the staining are, first, the bacteria which are not gram stained. Okay, usually all the bacteria are gram stained except the bacteria which are not possible by gram staining is the mnemonic is RCM. Okay, Rickettsia, Chlamydia, and Mycoplasma. And yes, the last one is Pyrochetes. So all this RCMS cannot be gram stained. Okay. Apart from this, one more organism is there, that is MTB. Actually, MTB can be gram stained, but it appears as gram positive bacteria. But still, there is a special stain for that. MTB is acid fast staining. So, acid fast staining is done for Mycobacterium. 20% H2SO4 is used for MTB. Whereas 5% is used for M. leprae. 1% is used for Nocardia. Less than 1% is used for staining the oocyst of coccidian parasites or spores of any organisms. Okay, so that's all about the gram staining and acid fast staining. India staining is a special staining. It is a negative staining, which is used to visualize the capsule of the bacteria. Okay, not only from bacteria, the fungus is the only fungus which is capsulated is Cryptococcus neoformans. Especially it is the preliminary test which is done from the CSF samples, okay, in case of any meningitis. And then granules of Corynebacterium diphtheriae. Okay, Corynebacterium diphtheriae is stained by the stain called Albert stain. Everything is given in the note, so I'm just moving very fast. Okay, then the question you may expect from staining, the advanced is called fluorescent staining. The name of the fluorescent stain is called Calca-Fluor white. Okay, Calca-Fluor white. It is a stain used to visualize the Candida species. Okay, and it is going to stain the part called chitin. Chitin of Candida is stained by the fluorescent stain called Calca-Fluor white. So you may get this as updated one. Okay, that's all about the staining part. We'll move on to the culture media. The important culture media are sorry. Basically, the culture media are divided into basic medium and enriched medium. Enriched medium, basic medium is nothing but simply nutrient agar. It is used to only grow the organism, whereas the fastidious organisms will be able to grow by using enriched medium and enrichment medium. Enriched medium is nothing but agar, that is blood agar, chocolate agar, LJ medium, LSS. Blood agar is used to see the hemolysis pattern of the bacteria like Streptococcus. Chocolate agar, once the RBCs are broken, all the factor 5, 10 will be released from the RBCs, which will be a growth factor for few organisms like Haemophilus and Neisseria. Haemophilus influenzae and Neisseria. LJ medium for TB. Lophless serum slope for Corynebacterium diphtheriae. Okay. Then enrichment broth. Enrichment broth is nothing. Example, the classical example is selenite F broth. F means feces. Okay, so for enteric pathogen, this is used. Enteric pathogens like Salmonella, Shigella, and alkaline peptone water is used for Vibrio. Okay. Then apart from this medium, there are special medium called differential medium. So differential medium means it is going to differentiate two different things. Okay, that's called differential medium or indicator medium. Example, so all this differential medium contains one sugar. For example, lactose, which means the organism which will utilize the lactose, if it ferments this lactose, it is called LF. If the organism doesn't ferment the lactose, it is called NLF. So this is how the medium differentiates two different organisms. It's mainly used for enteric pathogens and uropathogens. The classical example of differential medium is McConkey agar. Okay, the next is called transport medium. Transport medium is if there is any delays expected from for transporting the sample, this medium can be used. The examples are Pike's medium, Amy's medium, and Caribler medium. Pike's medium is pyogenes, P for P, strep pyogenes. Amy's means Neisseria. Caribler, okay, Caribler means Vibrio cholerae. Okay, that's all about the transport medium. Then selective medium, which allows only the pathogen to grow. That's why they are called a selective medium. Example are Mannitol salt agar, mannitol salt agar, Staphylococcus aureus SE, Staphylococcus aureus. Then modified Thyre-Martin medium, Neisseria gonorrhoeae, and plet medium for Bacillus cereus. The classical usual question will be asked is called TCBS. You all know that very well. That is Vibrio cholerae. Okay. Then buffered charcoal yeast extract agar, which is again the important question. Legionella. Okay. And then the latest one you have to know is called CCYA medium. Okay. CCYA medium is Clostridium difficile. From the stool, it is isolated. Okay. Then that's all about the culture medium. We'll move on to the biochemicals. Biochemical test. There are few biochemical tests which you must know. That is called coagulase test. Coagulase test is positive for Staphylococcus aureus, negative for coagulase negative species, Staph epidermidis and Staph saprophyticus. Okay. The next test is called catalase test. Catalase test is positive for Staphylococcus, all Staphylococcus species. Whether it is positive or negative coagulase, all the Staphylococcus species are catalase positive, and negative is Streptococcus. Then third one is oxidase test. Recently, this question was asked 2 years back with the picture. Okay, oxidase test. It will be violet in color. Oxidase test will be positive for Pseudomonas. If you get a history like burns patient and organism is isolated from the burns swab, which is received from the burns patient, and the test isolate was showing the oxidase test positive, the most common organism is Pseudomonas, which turns oxidase positive. And the next is called Vibrio cholerae. Okay, these are the two classical examples of biochemical test. Next is called culture methods. So what are the culture methods we can expect in question is to calculate the colony count from the plate. Okay, to calculate the colony count from the plate, the test method performed is called semi-quantitative method. Semi-quantitative method is used to count the colonies. Okay, count the colonies, that is colony forming unit, especially in urine samples. If the urine number of the organism in the urine sample is more than or equal to 10 to the power of 5 CFU, that is considered as a significant. Why? Because usually there will be common salts in the urine samples. That is, for those conditions, we use the counting method. That is called as a semi-quantitative. You may get this picture in exam. And the next is called Lawn method. First, Lawn method is the question. Previous question was asked in the TNPG was, what is the agar used for testing antibiogram? Antibiogram is nothing but antibiotic sensitivity test to check whether the antibiotic is sensitive or resistant. For that, the method used is Lawn method. Agar used is Muller-Hinton agar. This was the question. Okay, the question was not what is the method. The question is what is the agar used for performing the antibiogram. The question answer is Muller-Hinton agar. Okay, Muller-Hinton agar. It is used to detect the sensitivity and resistant pattern of the drugs. Okay, once the lawn is made, then the disc is kept. Okay, the antibiotic disc is kept in like this. 1 second. Once the lawn is made like this, the antibiotic disc will be kept over the lawn. If the organism is sensitive, it will form as a zone like this. If the zone is, that is called zone of inhibition. If the zone is produced, then the drug is sensitive. There is no zone means it is resistant. Okay, this is the one you have to know. This is how it is interpreted. The next is called, another question is, you cannot calculate MIC, minimum inhibitory concentration, cannot be calculated by this lawn method. That is Muller-Hinton agar method. That is the name of the test is called Kirby-Boyer method. So Kirby-Boyer disc test. The name of the test is called Kirby-Boyer test. What is the agar used is Muller-Hinton agar. Which one cannot be determined by this method is called MIC of the drug. So MIC of the drug is calculated by the test called E-test. Okay, the disc strip is available like this in this form. Here, zone will not be zone will be produced in a epsilometer pattern. Okay, this determines how much drug should be given. This is called MIC. It will be available in microgram. Okay, this is called as a E-test. This is the question. By E-test, MIC can be determined. by Kirby-Boyer disk method, MIC cannot be determined. Okay. The next is called bacterial growth curve. Bacterial growth curve is, there are 4 phases in this. Sorry, lag phase, a log phase, stationary phase, and decline phase. Lag phase, that this is the initial period where the organism is inoculated and we are giving the time for beginning of the growth. Okay, actually growth starts here, which means the cell number is not increased. Okay, cell number is same in this period, whereas here this is called exponential phase or doubling time. This is called doubling time. What is doubling time? It's just nothing but generation time, the time for bacterium to give 2 bacteria. Okay, bacteria divides by binary fission, right? One bacteria will give 2, one bacteria will give 2, and this will give 2. So this is called doubling time. This happens especially in this period, that is log phase or exponential phase. So in this phase, cell number increases. Okay, first phase, cell number will be same, only cell size are increased, whereas the second phase, cell number increased. Okay, this will be your question. And the third phase is called stationary phase. Stationary phase. Okay, here live cells will be equal to viable cells. Okay, and all the formation of the toxins, all the granules, spores will be formed in this called stationary phase. You can remember like spores, toxins, antibiotics, and granules, STA. Okay, all this will be produced in the stationary phase, which means that cell is ready to die. Okay, that is the next one, that is called decline phase. In decline phase, only dead cell will be there, which means cell division stops. Division stops. The question will be asked is where the doubling time starts. The doubling time starts in the exponential phase. Okay, that's all about the bacterial growth curve. Next is called requirements. Requirements, you all know that very well. That is, if the bacteria requires O2, that is called as a obligate aerobe. If the bacteria doesn't require O2, that is called obligate anaerobe. Okay, classical example is Clostridium. Obligate aerobe is, classical example is Pseudomonas. Pseudomonas. Okay, Clostridium species. You may get questions like CO2. If the organism requires CO2, that is called as a captophilic, and the percentage is 5 to 10%. Okay, 5 to 10%. Examples are Streptococcus brucella. Okay, next, thermophilic. The organism requires higher temperature, that is thermophilic, up to 80 degrees Celsius. The classical example, again, it's a question, Geobacillus stearothermophilus. Okay, it is able to tolerate such temperature. That is why it is used as a control in autoclave. Okay, one of the physical sterilization method, autoclave, which will usually run in 121 degrees Celsius. Okay, which means the spores of this particular organism will be able to withstand it. That's why it's used as a control in case of autoclave. Again, this is a question for you. Okay, thermophilic. Next is called, we'll move on to the sterilization methods and disinfection method. So sterilization method means it is able to even kill the spores, whereas disinfections will not kill the spores. That is a basic difference between sterilization and disinfection. There are methods, a variety of methods are there in sterilization. One is dry heat, another one is moist heat. Heating is one of the method. Heating again divided into dry heat, moist heat. Dry heat divided into two methods. It can be done by 2 methods. One is called hot air oven. The another one is incineration. Okay, hot air oven is 160 degrees Celsius for 2 hours. This is the ideal one, usually done in all the labs. Whereas incineration is 800 to up to 1600 degrees Celsius. It can be, which means it is able to kill all the biomedical waste, hospital waste. Okay, this will be a question. Hospital waste are usually processed by incineration method. Okay, except metals cannot be put in incinerator. Chemicals, gas, PVC, plastics and all cannot be done. Okay, rest of the all hospital waste commonly produced should go for incineration. Okay, hot air oven, that is 160 degrees Celsius for 2 hours it should be done. What are the things can be sterilized by hot air oven? The question will be all the surgical items can be done. Okay, scissors, scalpel and all. and chemicals, powder in factories, industries. These are the things can be done for, should go for hot air oven. Okay, next method of sterilization is called pasteurization. Pasteurization, the name itself, it is there, it is to kill the milk-borne pathogens. Okay, two methods are there, Holder method and flash method. Holder method, the ideal temperature and time is 63 degrees Celsius for 30 minutes. Flash method, 72 degrees. Flash means what? Suddenly the temperature should come down. 72, from 72, it should bring down to 13. Okay, hot method and cold method. And the time duration is 20 minutes. When we increase the temperature, the time should be reduced. Okay, this is called hot method and flash method. The question here is, by Holder method, Coxiella burnetii survives. This is the question. Okay, Coxiella burnetii, which causes some milk-borne disease, and it survived by Holder method, but killed by flash method. This will be your question. Okay, the next method is called inspisation. Inspisation. Okay, inspisation. The time is, it is actually a three-day process. Day 1, day 2, day 3. Which means 8 to 85 degrees Celsius, 20 minutes. Culture medias like LJ medium and LSS, egg containing medium, protein rich medium, serum rich medium, all this can be sterilized by inspisation. Okay, the next method of sterilization is called boiling, and at 100 degrees Celsius, boiling and tyndallization. Tyndallization. Boiling means 100 degrees Celsius for 30 minutes. It kills all the organisms, but not spores. Okay, to kill the spores, Tyndall was the one who introduced another technique called tyndallization, which is also called as fractional sterilization. So what is the ideology of this fractional sterilization? To kill the spores. Okay, so first, day 1, the materials will be put in for sterilization at 100 degrees Celsius for 20 minutes. Now what happens, all the vegetative bacteria which is there in the medium will be killed, but the spores, okay, they'll give that time for the spores undergo germination process. Okay, that is called day 2, and by day 2 the spores will germinate, right? So that vegetative bacteria will be killed by day 3. So it is again a day 3 process, but the temperature is 100 degrees Celsius. So this procedure was introduced by Tyndall, and the process was hence the process was further named as tyndallization. Okay, the aim is to kill the spores. Culture medium like sugar containing medium, gelatin containing medium can be sterilized by tyndallization process. And the next is called steam sterilizer. Very, very important. You may get question here. Steam sterilizer. The classical example is autoclave. Okay, two types are there: flash autoclave, routine autoclave, which will be done in the lab. 120 degrees Celsius for 15 minutes for at 15 psi. If we in flash means what? Immediately we need, in case of any emergency situations like emergency OT. Usually this will be done in OT. This autoclave temperature will be done in lab and CSST. Okay. In OT, if any emergency situations, if they need all the surgical items, they'll increase the time temperature from 121 to 134 degrees Celsius. Okay. When we increase the temperature, duration can be reduced from 15 minutes to 3 to 10 minutes. Okay, this is called flash autoclave. You may get questions like this. In case of emergency situation, flash autoclave may be, flash sterilizer may be used. Okay, what are the things can be sterilized by autoclave? All the culture media except LJ, LSS. This will be a question. Okay, exceptions are there, and all the surgical items except sutures, catgut sutures and graft items cannot withstand such high temperature. That's why they are not putting in the autoclave. That is the question here. So you make it question like culture media exception LJ, LSS, and all surgical item except catgut and graft. What is flash autoclave in case of any emergency situations? The next method of sterilization is called filtration method. Two filter are there. One is called membrane filter. Another one is called HEPA filter. Membrane filter is used to filter or is used to sterilize any antibiotics, okay, serum, vaccines, like that. Whereas In case of HEPA filter, high efficacy particulate air filter. Okay, it is air filter. It filters 99.7% of the particles, and the size is 0.3 micron size. Okay, so the air efficacy will be this much pure. It's used in all OT. Nowadays, all OTs are HEPA filtered OT, and all the biosafety cabinets in the labs are HEPA filtered biosafety cabinets for the safety purpose. Okay, this you may get questions. Okay, it's update. The next method of sterilization is called radiation. Again, ionizing radiation, non-ionizing radiation, X-ray, gamma rays, and UV rays, infrared rays. Again, infrared, UV is there in all the OT, right? Again, it is used to kill the organisms and spores, fumigation purpose. Whereas X-ray, gamma rays, this gamma rays, we studied two exceptions there, right? That is catgut suture and graft. Catgut sutures and graft items. Sorry, 1 second. Graft items and syringes, pre-packed syringes. This will be your question. All these are sterilized by gamma radiations. Okay. Autoclave sterilize all the surgical items except these two. These two are sterilized by gamma radiation. Okay. Next, the update in the sterilization chapter is LTGS. That is low temperature gas sterilization. Okay, the examples are EtO2 gas, H2O2 gas. H2O2 gas is called plasma sterilization. EtO2 gas is very explosive, commonly done. Okay, it is again commonly done in all the hospitals. It cannot be used in 100%. 100% never used because it is explosive. Only 3 to 10% is required. The remaining 90 to 97% of inert gas should be mixed. Okay. Used to sterilize the heart-lung machine. The temperature is, I said it is low temperature, right? Low temperature. What is the temperature? 38 degrees Celsius. This will be your question. 38 degrees Celsius, low temperature. So that is how it is safe again, but it is unsafe because it is explosive. Again, it is a commonly done procedure in all the hospitals. You should know. It is not all the, it is, I mean, like, it is applicable for all heat sensitive items. That is question. Heat sensitive items. What is the item can be sterilized? That is heart lung machine will be a question. Plasma sterilization, all the microvascular instruments, because it is very big in size. Okay, it is a room. It will occupy more space in the room. Whereas plasma sterilizer is a small in size and name is called Sterad. Okay. It is very what to say, handy thing. So all microvascular instruments can be sterilized. So you may get question heart lung machine and microvascular instruments. Okay, and the next important question you may expect is called controls. So how to check whether all the sterilization is good or not? Okay, that is why we keep all the controls over during the sterilization process. Okay, that is to check that physical, chemical, and biological indicators. Physical, chemical, you won't any question. Biological indicators, definitely question will be asked. So what is a biological indicator? For autoclave H2O2, Geobacillus stearothermophilus. For hot air oven and EtO2, Bacillus atrophius. Okay, at hot it. So you can remember like this. And filtration process, Brevindimonas diminuta. Filter minute things will be filtered, right? And radiation. Radiation is Bacillus humilis. Radiation is humilis. Arc fever. Okay, so these are the indicators can be used during the sterilization process. Sterilization is over. Next is called disinfection. Disinfection, the question you may get here is, there are levels of disinfection. One is low level disinfection, intermediate level disinfection, high level disinfection. Remember that low level, intermediate level will not kill the spores. Okay, will not kill the spores. Whereas high level disinfection at higher concentration, previously I said disinfection itself will not kill the spores, but except high level concentration at high level disinfectants at high concentration will kill the spores. Okay, will kill the spores. This you have to know. And what are the routine disinfectants used in hospital is commonly used is called Sidex. So what is Sidex? Yes, previously this question is asked, that is 2% of Sidex, 2% of glutaraldehyde. Glutaraldehyde is used for disinfecting all the scopes. The question will not be asked like this. Scope, bronchoscope is used for a TB patient, and another patient, can the same scope will be used or not? That will be a question. Yes, it can be used because it is mycobactericidal. It even kills the TB. Okay, so this question you may ask. This question can be asked, 2% for 20 minutes. This time is and again important. 2% at least for 20 minutes, 20 to 45 minutes is very, very important. Okay, it is even sporicidal agent. Another one is called hemodialyser machine. This question latest one I just saw. Hemodialyser machine, interior part of the hemodialyser machine is disinfected by 3%, that is peracetic acid. Peracetic acid can be even better with the combination of H2O2. Okay, and the routine OP instruments like BP cuff, stet, thermometer, isopropyl alcohol wipe itself is, it was previously older questions. Okay, but recently you may expect this Sidex and hemodialyser. And one more thing is sodium hypochlorite. Okay, sodium hypochlorite. 2 years back it was asked, okay, what is the percentage of the sodium hypochlorite? You all know that sodium hypochlorite is used in any blood spill. They'll go and pour, right? But the question is, what is the percentage? The percentage is 1%. In 1% itself is sufficient to kill the blood-borne viruses like HIV, HBV, and HCV. The question here is 1% of sodium hypochlorite is used in blood spill. Okay, so that's all about the disinfectants. The next chapter is called genetics. Bacterial genetics. It is again, students always get confusion in this chapter. Genetics is nothing but we are going to study the genetic property of the bacteria. That's it. So if consider this as a mother bacteria, this is daughter bacteria. We want to transfer all the gene property, or whether it is resistant property, whether it is virulent property, whether it is pigment property, whatever it is, the mother bacteria should produce all the property to its offspring. That is the aim, right? So this is called gene transfer. Okay, it is actually interesting chapter. Once if you put interest on this topic, it will be very interesting. Otherwise it will be very boring and dry chapter. Gene transfer are of two types. By two methods it can happen. One is called horizontal. Okay, horizontal. Another one is called vertical. We all know that vertical means mother to fetus. Okay, horizontal means from, for example, if this is E. coli, this is another bacteria, that is staph. By this way also it can spread. This is called horizontal, from one bacteria to another bacteria. That is called horizontal method. Okay, this horizontal method are of three types: transformation, transduction, conjugation. Transformation means direct transfer from one bacteria to another bacteria without any mediator. Whereas if there is any mediator helping, that is called bacteriophage. Bacteriophage, you all know that, right? It is tail-like, tadpole-like structure. It's actually a double-stranded DNA. It's a DNA virus which is going to eat the bacteria. That is what actually does, right? Instead of, during that process, this helps the transfer of genetic material from one bacteria to another bacteria. This is called transduction. Okay, conjugation means pili. There is a special structure called pili. This is called pili or sex pili. Okay, this is conjugation. F plus will convert the F minus bacteria to F plus. This is called conjugation method. So this is how you have to know the gene transfer. The next chapter is called resistance. Resistance. What is bacterial resistance? Two types are there: intrinsic resistance. Another one is called acquired resistance. It is nothing but nature. By nature itself, some bacteria will show resistance towards some organisms. For example, metronidazole anaerobe it is actually a drug of choice for anaerobe, right? So this is how innate resistance occur. Okay, whereas acquired, so no need to concentrate on innate resistance. Forget about it. What is acquired resistance? Acquired resistance means during the course of infection. During the course of infection or during the time of colonization, the bacteria occur, the resistant property is acquired. That is how. Okay, that is what we need to know. What is the mechanism of this acquired resistance. Okay, for example, this is a bacteria, and this consider this as a antibiotic. Okay, this is antibiotic. What actually does the drug antibiotic will come and attack the bacteria. This is what usually does, right? I'll label this is bacteria. First, number 1 point, this antibiotic will not even able to enter inside. That is called decreased permeability. This is one of the resistant mechanism. Next one, if at all the drug enters also, if at all the drug enters also, it will be pushed out. That is called efflux mechanism. Okay, if at all the drug enters, it will be able to survive also. The drug survives, try to survive inside the bacteria, but the bacteria produces some enzymes. Okay, enzymes produce funny. That enzyme will come and inactivate. That is called as the enzyme inactivation. Okay, enzyme inactivation. You all know that very well, right? Penicillinase and beta lactamase. These are the common mechanism of enzyme inactivations. Okay, and another very important, which is unknown factor, is called altered target site. Okay, altered target site, which means if suppose this is the target site for the bacteria, for the drug to sit on the bug, means this site is changed to, if suppose this is the shape, this is the shape actually, this is the receptor for binding the drug. But the bacteria, by knowing that the antibiotic is coming and killing them, by knowing that, then the bacteria will change the shape to like this. Okay, this is now that the drug will get confused. Where is the site to go and sit, right? So this is called altered target site. This is the mechanism of MRSA. So you may get question, what is the mechanism of MRSA? Is altered target site. MRSA means the routine, the normal penicillin binding protein is replaced by penicillin binding protein 2A. So because of that, the isolate become less affinity towards the all beta lactam group of drugs. Okay, not only beta lactam inhibitor group of drug also. So all this group of drugs will not work on the MRSA isolate. So this question you may get, what is the mechanism of MRSA? Okay, so this is how the acquired drug resistance happens. The next chapter is bacteriology. We'll move on to the bacteriology, systemic back. So we finished the entire general part. We are moving on to bacteriology. Okay, 1 second. Is it not visible as a full screen? I got the comments in chat. Is it not visible as a full screen? Okay. First, let me start with Staphylococcus aureus. Staphylococcus aureus, it is the question here is most common colonization site is called NAG, nose, axilla, groin. Okay, if we want to detect the carrier, MRSA carrier means definitely the swab from these 3 sites should be taken. Okay, that is what the most common colonization site. Next is called most common infections, most common cause of skin and soft tissue infections, most common cause of bone infections, and nosocomial infections, especially pneumonia and SSI. This will be a question. This is the latest one. Okay, nosocomial infections are emerging. The topic of nosocomial infections are emerging. So the causative agent will be mostly Staphylococcus. If it is MRSA, you have to think of whether it is healthcare worker related. Okay. The next is called intoxication. Toxins responsible for the condition is called food poison. Food poison. Staph aureus food poison is usually the incubation period will be very shorter. Incubation period is less than 6 hours. Okay. And ingestion of dairy products. So history of dairy product intake will be there. Within 6 hours, the patient complains of fever, vomiting, and all. You have to think of Staphylococcus aureus. Next, scalded skin syndrome and Reiter syndrome. So the toxin responsible for this exfoliative toxin. Next, toxic shock syndrome toxin, TSST. The toxin name is TSST. It is a super antigen. The question here is superantigen, and it causes shock-like features in case of menstruating women or using vaginal tampons. Okay, and apart from routine lab identification, what is the thing you have to know is what is a selective medium, mannitol, salt, agar, and mechanism of MRSA, which is already discussed, that is altered target binding site. Okay, PBP2A maridum. The next is called, the next question is, what is the gene responsible for this is called MECA gene. MECA gene is this resistance is mediated by MECA gene. Okay, there are two types of MRSA, that is hospital acquired and community acquired. Hospital acquired, previous history of hospitalization should be there, and it is less virulent strain. Okay, and but more resistant. Usually it will be MRSA that is resistant to all beta-lactam and beta-lactam inhibitor group of, whereas community strain is the toxin which is responsible for community strain question here is Panton Valentine toxin, PVL toxin. Okay, how to detect MRSA? Question previously asked was, one is disc diffusion method. Yes, it can be detected by disc diffusion method using cefoxitin as a marker. But cefoxitin is not used to treat. It is only for diagnosing the MRSA. Number one. Number two, PBP2A can be detected by latex agglutination test. Number three, MECA gene, which is responsible for the resistance, can be detected by PCR, and phage typing can be done. The phage typing 80, 81 usually are of hospital strains. Okay. So that's all about the Staphylococcus aureus. Staphylococcus coagulase negative Staphylococcus, I said two species, right? Staphylococcus epidermidis and Staphylococcus saprophyticus. S for S, sexually active females la UTI இருக்கும். Sexually active females la UTI. S for S. Epidermidis is able to produce a biofilm formation. Okay, it's able to biofilm formation and causing prosthetic valve infective endocarditis. Causing biofilm in the prosthetic valve. அதுக்கு மேல வந்து biofilm cause பண்ணும் infective endocarditis. Okay, E for endocarditis, S for sexually active female urinary tract infection. Streptococcus, again the question will be asked here is called alpha, beta, gamma. Alpha are two species, strep viridans and strep pneumoniae. The differentiating point between strep viridans and pneumoniae, both are alpha hemolytic. Okay, fine. The differentiating point is okay, viridans dental caries. Okay, pneumonia will cause meningitis, acute pyogenic meningitis. Okay, acute pyogenic meningitis, the question here is. But what are the differentiating points between these two? That is, grams, viridans is arranged in a chains, pneumonia arranged in a pairs. Okay, but this is capsulated. The arrangement of this is, it will appear like this. Okay, the next is called capsule. Capsule absent, yes, plus. Meningitis, always remember that the organism causing meningitis will be capsulated. For example, Cryptococcus neoformans, yes. Streptococcus pneumoniae, yes. Neisseria meningitis, yes. Haemophilus influenza type B, yes. So all these are capsulated. Okay, the next is called blood agar plate. Blood agar plate both shows alpha hemolysis. Next, BIOM. You can remember like inulin, optocin, mice pathogenicity. It will be negative, it will be positive for pneumonia. Okay, mice pathogenicity, yes. Optocin sensitive, yes. Inulin ferment, yes. Alpha hemolysis, capsulated. Gram positive cocci in pairs. 2 to work. Okay, next. Beta hemolysis. Beta hemolytic streptococci is strep pyogenes. Strep pyogenes, definitely they'll ask you what is molecular mimicry. Molecular mimicry na bacteria la irukra oru partum host la irukra oru partum same ah irukum. That is called molecular mimicry. Okay, molecular mimicry. That is M protein mimics like myocardium host surface. Okay, then group A, C carbohydrate of bacteria mimics like C for cardiac valve. Okay, And then peptidoglycan of bacteria mimics like skin antigen. Cytoplasm of the bacteria mimics like blood vessel antigen. Okay. Next is called route. How this spreads the infection, that is called respiratory droplet. Via respiratory droplet, it causes pharyngitis, URI-like features. Via skin-to-skin contact, especially in school-going children up to 5 to 15 years, is more common. Skin-to-skin infection, it causes skin infections like impetigo. Okay. So the age mostly affected will be 5 to 10 or 5 to 15. That is the age group affected. What are the infections? You can remember with the mnemonic called spine, scarlet fever, pharyngitis, impetigo, necrotizing fasciitis, erysipelas. Okay. What are the complications of strep pyogenes? Two important complications are rheumatic fever and post-streptococcal glomerulonephritis. History of sore throat will be there. Throat to heart. Here, skin to kidney. You can remember like this. Throat to heart, sore throat. And skin to kidney. Skin means recurrent. So which means what? History of recurrent skin infections will be there. Which is very, very important. And early serotypes will cause heart. That is late serotypes, 40, 42, 53, 55, 59. Late serotype will affect the kidney. Okay, you can remember like this. Recurrences are common. In case of rheumatic fever, here it is not. So penicillin prophylaxis is needed. Prophylaxis is needed for rheumatic fever because of more recurrence. Here it's not needed. Bad prognosis. This is good prognosis. Okay, ASO titer is helpful for identifying the rheumatic fever. It's a retrospective test. Okay, more than 200 IU. That is helpful for rheumatic fever rather than PSGN. This will be a question. Next, group A galactiae. Streptococci A galactiae. Okay, group B streptococcus. That is, it is usually colonizer in female genital tract. Okay, usually colonizes in female genital tract. It is a colonizer. It will not cause any infection. It is a colonizer. Whereas in case of pregnancy, when immunity goes down, it causes puerperal sepsis. Okay, this will be a question. Okay, puerperal sepsis or urinary tract infection because of normal vaginal delivery. Normal vaginal delivery, there are chances of colonizing the baby also, and that in such condition, because of unhygienic delivery, conducting unhygienic delivery, the neonate may get infections like meningitis. Okay, if it is early onset, usually it is a peripartum spread. If it is late onset, usually it will be from a nosocomial. We have to think like that. Okay, but neonate with meningitis from via the genital tract means usually strep A galactiae will be the common. And the next is called gamma, that is non-hemolytic. The organism is called enterococci species. Okay, among them, most common species is fecalis. Okay, it's usually a normal flora of GIT and GUT. GIT means it causes intra-abdominal abscess, peritonitis. GUT means urinary tract infections or catheter associated urinary tract infections also. That's all. Next, Neisseria. Okay, Neisseria, there are two species, Neisseria meningitidis, Neisseria gonorrhoeae. Neisseria meningitidis usually colonizes the nasopharynx. This colonizes the genital tract. Okay, genital tract. Nasopharynx la colonize agi, and it spreads nasopharyngeal colonization. It invades. Okay, this is capsulated, right? Neisseria meningitidis. I said already, all the capsulated will invade and causes meningitis. Whereas genital tract colonizers, mostly it will not invade. It will cause only local. In males, it will be symptomatic. Mostly symptomatic in male. This will be a question. And causes gonococcal urethritis. Okay. In females, it will be asymptomatic. Females, it will be asymptomatic and causes vaginitis, urethritis, cervicitis and all. Okay. And the complications will be water can, perineum. And here the complications will be, in meningitis, the complication will be Waterhouse Friderichsen syndrome. Okay, it is disseminated meningococcemia. So it presents with fever, low BP, reduced BP, shock conditions, bilateral. This is mainly due to bilateral adrenal insufficiency. Okay, this will be your question. Yes, next, Cornybacterium. Cornybacterium, there are 3 species are there. Gravis, GIM, intermedius, and mitis. Okay, mitis. Mitis means less, minus. Remember, mitis means minus, right? It is less toxigenic. Among all the species, which is less toxigenic? Answer is mitis. Which is more toxigenic? Gravis, graveyard like. Okay, so this is more toxigenic. This falls in between. So don't bother about intermediate. Okay. Another one is, they all are granules. Okay, Cornybacterium diphtheria polymetaphosphate granules. Okay, it's very clear, right? But more granules, less toxigenic, but more granules. Here, the granules will be less. Here, more granules, less granules. The question will be asked from which of the species producing less granules. Okay, and the colony morphology, it's very older questions. That is daisy head colony and frog's egg. The recent nobody is asking, I think. Okay, next is called poached egg. Okay, next, the important one is source of the infection is called cases or carriers. Okay, root is direct contact or droplet. Causes diphtheria, yes. It is faucial. Faucial diphtheria is the most common among them. Faucial diphtheria is most common. What is the finding? Most common finding is, the question is, most common finding is pseudo membrane. Okay, pseudo membrane on tonsils. And appearance is bull neck. It appears as a bull neck appearance. Okay, most common complication is myocarditis. This is the most common cause of death also. Okay, and yes, this is the main thing. 100% humans is the only reservoirs. There are no animal reservoirs and all. Okay, and yes, Albert stain is the one which is used to stain the granules, which we already saw. In grams, what is the appearance called? Chinese letter pattern. Chinese letter pattern, which we already discussed that. And enrichment medium is lawless serum slope. Yeah, we discussed this already in medium. Lawless serum slope can be sterilized by not autoclave. Remember that, not autoclave. Okay. Next, selective medium is called potassium telluride agar. Yes, another important biochemical test is positive for urease test positive. Next, LX toxin demonstration can be done by LX gel precipitation test. This will be a question. Okay, that's all about the questions among this. And the Cornybacterium minutissimum. This is the non-diphtheroids. Minutissimum causes erythrasma. Okay. And Woods lamp coral red appearance. Cornybacterium urea-lyticum is another species, causes UTI. Jaicium. Again question. Endocarditis. Okay. Again, endocarditis, I said, prosthetic valve is staph epidermidis. Okay. Next, listeria. What is listeria? Listeria monocytogenes. Okay. Can remember like it causes gastroenteritis. food poison. In case of pregnancy, abortion, preterm, neonate, from pregnant mother to baby, if it spreads, it causes meningitis, low birth weight babies. Okay. And the property of the listeria is it survives at 4 degrees Celsius. That is cold environment. Cold enrichment medium. This question is the bacteria survives at cold is temperature is listeria. Okay, cold enrichment. So mainly that is why cold store panna foods la irundhu da varum. Okay, stored foods, refrigerated foods are the source. And yeah, the main property in pata camp test positive. That is what this is what the question. C for cold, another C for camp test. Okay. Next is Bacillus. Bacillus, 2 species are there, Anthracis and Ceres. Anthracis, bioterrorism agent. 3 types are there. One is called cutaneous. Next is called lung, inhalational lung. Then ingestion. Okay, cutaneous la vandu eschar will be there. Lung la vandu infiltration, pneumonia. Ingestion la vandu bloody diarrhea. Okay, there are many lab ID points for Bacillus anthracis. You may get as questions. Number 1, bamboo stick appearance. Okay, bamboo stick appearance in grams. Number 2, McFadden's. McFadden's for capsule demonstrations. Then gelatin stab on the inverted filtry appearance will be there. Gelatin stab on the inverted filtry appearance. Okay, then blood agar plate with pencil and drug la pathona string on pearl appearance. String on pearl. Okay, string on pearl and Medusa head appearance. Medusa head appearance. So all these are lab ID points for Bacillus anthracis. The another species is Bacillus cereus. Bacillus cereus will cause food poison. So what is the food? Chinese fried rice. History of Chinese fried rice intake. The incubation period will be very shorter, that is up to 6 hours. The serotypes are early serotype. Okay. Whereas intake of veg, contaminated veg, meats, cereals. Okay, incubation period is longer, 8 to 16 hours. And the serotypes are late, 2, 6, 8. Early serotype will cause vomiting. Okay, emetic type. Whereas late serotype will cause diarrhea. You can remember like this. Okay, I said already, Geobacillus is a newer name. Bacillus stearothermophilus. Stearothermophilus is another species used as a control for autoclave biological indicator. Okay, then Bacillus atrophius, hot air oven, and ETO. Okay, so that's all about the Bacillus. The next bacteria is Clostridium. Clostridium, again, all the 4 species are seen. Very, very important. Okay. Number 1, perfringens. Number 2, botulinum. Number 3, tetanus. And the last is called difficile. Difficile is very, very important. And recently, in all the exams, questions on difficile is asked. Okay. Number 1, perfringens. The toxin responsible for perfringens is alpha. Botulinum is BT. Tetanus is tetanospasmin toxin. Difficile is tox A and tox B. Okay, alpha toxin causes gas gangrene. It has a phospholipase property. Okay, botulinum toxin acts on the peripheral cholinergic nerve, inhibits the acetylcholine release and causes flaccidity. Tetanospasmin toxin acts on the inhibitory neuron toxins and inhibits the release of GABA and glycine, causes spasticity. Tox A and tox B will cause, in case of prolonged hospitalization or prolonged antibiotic intake, this causes cell damage. Okay, this causes cell damage, cytotoxin cell damage, and that is how it causes diarrhea or pseudomembranous colitis, antibiotic induced diarrhea or pseudomembranous. One is called, okay, next is called spasticity. Spasticity means history of trauma or history of road traffic accidents with spores. Okay, that is how tetanus occurs.
Ma'am, screen is not visible.
Spasticity. Screen it not visible.
Yeah.
Ma'am.
Shall we end this and join back again? What is the problem? Is it now visible?
No, ma'am.
No, ma'am.
We
Still not
couldn't
visible.
see the screen, ma'am.
Okay, we'll just end up and then we'll come back.
Okay, ma'am.
Is it visible now?
Yes, ma'am.
Yeah.
Yes.
Ma'am.
Okay. So Clostridium perfringens, gas gangrene, botulinum, floppy baby syndrome, flaccidity, tetanus, spasticity, rigidity, spasticity of the muscles that looks the appearance like one second. Hello, I'll just call you back. Opisthotonous posture and trismus. Okay, then difficile will cause PMC and diarrhea. Okay, so this is what you have to know, and all the lab ID points. Lab ID points for perfringens. What are the lab ID points for perfringens is Nagler's reaction to demonstrate the toxin. The question previously TNPG question was asked on this, and reverse camp test, target hemolysis. Target hemolysis is method double hemolysis. Okay, due to alpha toxin and theta toxin. And then litmus red reaction. Litmus means lactose. So it ferments lactose with abundant gas. Gas production will be like stormy appearance. That is why it produces stormy in the tube. And that is how it is causing litmus red reaction. Okay, next is called botulinum toxin. BT toxin, again toxin demonstration, mouse test in vivo, in vitro. No question was asked in the botulinum. Regarding tetanus, is tetanus producing strains showing swarming. Swarming is usually produced by Proteus, but in case of tetanus also, there are swarming will be seen. Okay, tetanus producing Clostridium species produces swarming. And question asked here is drumstick appearance. Yeah, drumstick appearance. The GPB appears as a drumstick appearance and fir-tree appearance. Regarding Bacillus anthracis, it shows inverted fir-tree. Here, fir-tree appearance. So that's all about the question points here. And Clostridium difficile, you have to concentrate on Clostridium difficile. Clostridium difficile usually colonizes even the healthy patient. Okay, whereas prolonged hospitalization and the patients who intakes prolonged antibiotics. So what happens? This organisms will go and colonize even the patients also, in healthy patient also. So how to differentiate? With what test will differentiate this strain? Okay, which is the virulent strain like that. So Clostridium difficile colonizes here also, and the difficile strain produces GDH antigen, glutamate dehydrogenase antigen, and this will be seen both in healthy patient and immunocompromised also, and those who are taking antibiotic also. Definitely this test also will not be useful. By culture, yeah, colonizing both, right? So both will produce growth in the culture. So culture again will not be useful, right? It's a non-specific test. So what is the test? What is the culture medium? I said CCYA. This is again question. By what test we can detect? That is toxin demonstration. Toxin detection. What is a toxin? I said tox A and tox B. It will be negative in healthy patient, whereas this tox A will and B will be positive in case of hospitalized and antibiotic intake patients. Okay, this toxin demonstration can be done by ELISA or molecular test, that is PCR. So the question here is, by what test we can differentiate? We can identify the Clostridium difficile. That's all. The question here is, specific test is ELISA and molecular PCR. Culture won't work, serology won't work. Okay, serology la ELISA is helpful, but only for toxin demonstration, not for antigen demonstration. Okay, then if we do colonoscopy, it will be normal here. It will be pseudomembrane formation here. So that's all about the difficile. We have to withdraw the antibiotic. And next is actinomycetes. Actinomycetes. There are two organisms are there. Actinomyces. Myces is a bacteria. Then nocardia. Nocardia. Okay, nocardia is aerobe. Remember, nocardia is aerobe and AFP positive, that is 1% H2SO4. Whereas actinomyces is anaerobe. Anaerobe, non-acid fast. Okay, both will cause actinomycetoma. Actinomycetoma, which mimics like mycetoma in fungus. Okay, triad will be there. Subcutaneous swelling, discharge sinuses, and granules. This is a triad of the mycetoma, but this is producing by bacteria. This is fungus. That is why they are called as eumycetoma in fungus. And the most common site will be jaw. Okay, condition will be lumpy jaw. Chronic subcutaneous granulomatous swelling. Okay, all term it's applicable for this. And definitely here, history of any procedure, surgical procedure would have been there. Like tooth extraction, some surgery would have been done in case of this to get colonized. Okay, so that's all about this. And another point is treatment. Treatment wise, penicillin, cotrimoxazole. Penicillin, cotrimoxazole. Okay, you can remember like no-co. Okay, knock-cot, like that you can remember. Penicillin will act on actinomyces. Next is, we'll move on to the big family, that is Enterobacteriaceae. Enterobacteriaceae. Number one, that is E. coli. E. coli strains are causing two different, broadly I can say that diarrheogenic E. coli, uropathogenic E. coli. Diarrheogenic E. coli are 5 types are there. E, you can remember with the mnemonic called T, A, P, I, and H. Okay, T, A, P. Toxigenic. It is there in the notes. I think you can follow. Toxigenic, aggregative, pathogenic, invasive, hemorrhagic. The first 3, that is TAP, will cause tap water, right? So it watery diarrhea. It produces watery diarrhea. E and H, they are invasive. Okay, whatever goes by invasion, it produces bleeding. Okay, so bloody diarrhea, which means dysentery. Okay, watery diarrhea means large intestinal involvement. Invasive means small intestinal involvement. Okay. Next, the most traveler's diarrhea. Okay, traveler's diarrhea is seen with ETEC. You may get question like that. Infantile diarrhea. Infantile diarrhea means EPEC. EP for pediatrics. Okay, you can remember like infantile. Another one is HUS, hemolytic uremic syndrome, more toxigenic strain. That is Shiga toxin. Shiga toxin. EHEC. Okay. The next is most severe strain. E. coli O157H7. This you may get as a question. Most severe strain. And HUS triad, you all know that, right? RET. Renal impairment, encephalopathy, thrombocytopenia. Okay. So that's all about the diarrheogenic E. coli. Uropathogenic E. coli, mostly the early serotype 1, 2, 3, 4, 5, like 6 like that, they produces uropathogenic E. coli. Uropathogens important virulence factor pathona fimbriae. What is the role of fimbriae? Pili helps for addition. So they have to adduce first. So where are these sources? From where the E. coli? E. coli is usually in the, where it will be there? Colon, right? Colon லருந்து எப்படி அது வந்து கிட்னி இந்த ட்ராக் போகுது, GIT இருந்து எப்படி GUT க்கு போகுது? First, because of the nearby presence of the anal canal, distance between the anal canal and the urethra is very short, small, right, and shorter. So that is why it transfers. So first, colonization, peri-anal colonization. This colonization should be strong enough to cause disease, right? That is helpful by fimbriae and capsule. So these are the two virulent factors is necessary for causing UTI. Okay, the next is called Klebsiella. Klebsiella species pathona pneumonia. Name itself is there, pneumonia. Causes lobar pneumonia. Okay, it produces red currant jelly sputum because of the mucoid property. Okay, because of mucoid property is due to the presence of capsule. It is producing capsule, right? I said whatever the organism is capsulated, producing meningitis. Okay, this Klebsiella meningitis is not so common in adult. It is common in neonate. Okay, the next is called, it is again, it is a major part in GIT flora, right? GIT flora are the most common cause of UTI. Again, UTI, E. coli, next to E. coli, Klebsiella pneumoniae is most common. Apart from this, it is causing nosocomial infection nowadays. Nosocomial infections usually would be MDR strain, multi-drug resistant strains. Okay, that's all about the pneumonia. And the next species is Ozane. Ozane will cause rhinitis, atrophic rhinitis, and rhinoscleromatis will cause rhinoscleroma. Scleroma means mask-like structure. Okay, the next is Proteus. Regarding Proteus, again, Proteus species, urease positive. First point, in biochemical itself, you have to know urease positive. Then, because of that property, breaks the urea into ammonia. When the ammonia is released, the pH will be high, right? The pH will be high. And also makes the urine alkaline pH. And this is responsible for the phosphate calcium deposition. And that is responsible for the renal calculi. Okay, this is the mechanism you may get as a question. Another one is swarming. Clostridium tetani, some strains also will produce swarming. Then Dine's phenomena. Dine's phenomena means this is swarming. When we treat two different Proteus strain, it is telling us the relatedness of the strain, whether it is same strain or different strain. If it is same strain, both swarm will get fused. If it is different strain, they will interlace each other. Okay, that is called Dine's phenomena. Okay, next is called Salmonella. Salmonella porthavara, yeah, we all know that Salmonella, it is a step ladder fever, coated tongue, splenomegaly, rose spots, everything. History is enough. Okay, the class clinically it is divided into typhoidal, non-typhoidal. So far the history இப்ப சொன்னது எல்லாமே typhoidal வரும். Typhoidal is due to typhi, paratyphi A, B. Okay, the most common is typhi. Among the paratyphi, A is the most common. Now even typhoid cases are being recorded. Okay, next is called non-typhoidal strains are Salmonella typhimurium. Okay, typhimurium. Remember, this is mostly waterborne. Here, history of improperly cooked food. Okay, that history will be there. And gastroenteritis, this is fever of unknown origin history la vandrum. So idile vandu ungalku differential diagnosis will be very easy. Typhoid, paratyphi A, B, fever of unknown origin. Whereas non-typhoidal species, typhimurium, cholera suis, இது எல்லாமே வந்து AGE ல வரும். Okay, history of some food intake which is improperly cooked. Next is, I'm not going to teach the case scenario and all. Lab diagnosis. Yeah, who are the source? Obviously, carrier are the source. So we need to detect the carrier. We need to detect the case also. How do the case present? Fever. So fever enna test பண்ணுவோம், blood culture பண்ணுவோம். Blood culture enna demonstrate பண்ணுவோம்? Organism. bacteria. Okay. The next, once the bacteria enters and survives inside the blood, it will produce antibody, right? So antibody stage la வந்து serology test. Serology test la வந்து antibody பார்ப்போம். Okay. The next is called carrier. The next stage, once antibody develop ஆச்சுனா patient will recover. So அந்த டைம்ல patient will secrete the bacilli in stool and urine. So இந்த டைம்ல stool culture பார்க்கலாம், urine culture பார்க்கலாம். Okay, so carrier detect பண்றதுக்கு stool urine தான், patientல next stage is stool urine தான். So you can remember with the mnemonic of BASU, BASU. How to detect the carrier in the indirect way means you can culture the sewage. Collect the sample from the sewage area and do culture and isolate the organisms and identify the organisms. Okay, so this is how case detection and carrier detection. And another thing what you have to know is treatment. Treatment is previously AC cot, okay, ampicillin, chloramphenicol, cotrimoxazole were used, but they all started showing resistance via plasmid mediated. And later on, they shifted to the drug group called ceftriaxone, third generation cephalosporin, ceftriaxone, one fluoroquinolones, azithromycin. Nowadays, empirically, we can give ceftriaxones. Okay, and this fluoroquinolones is used for MDR strain. If all the drugs are resistant, like A, C, COT, ceftriaxone, azithro, you can go for fluoroquinolones. Okay, fluoroquinolones are always preserved drug for ATT also. Okay, levofloxacin also. That is why we have to preserve fluoroquinolones. Next is called non-typhoidal. As I said previously, non-typhoidal means mostly zoonotic poultry, history of intake of improperly cooked animal foods, okay, like egg, poultry and all. And in case of Salmonella typhi, macrophage involvement will be there, infiltration. In case of non-typhoidal, neutrophil involvement will be there. Okay, and here I said it's FUO, this is AGE. Okay, here they have autoimmune mechanism. This NTS have autoimmune mechanism because of the arthritis, meningitis, uveitis, all these things will happen. Whereas in case of Salmonella typhi, no autoimmune mechanism. They directly go for carrier stage. Okay, carrier stage. For another question is how to detect the carrier. This I think I didn't put in the notes. You can write it down. VI antibodies will be detected for carrier stage. For cases, O and H antibodies can be detected. For carriers, VI antibodies will be detected. This will be your question. Next, Shigella. Okay, Shigella, dysentery, flexneri, boidy, sony. Your question will be most severe. Most common will be flexneri. Most severe will be your dysentery. Okay, and the most common toxin producing this is called Shiga toxin. Like EHEC மாதிரியே இருக்கும். Okay, most common will be large intestine, invasive. Large intestine நாலே invasive நாலே dysentery இருக்கும். Okay, next question பாத்தீங்கன்னா protein synthesis, mechanism of the Shiga toxin. They will ask you protein synthesis inhibitor. Protein synthesis inhibitor mechanism எல்லாமே tissue damage பண்ணும். Tissue damage பண்ற எல்லாமே bleeding cause பண்ணும். What are the other toxins produced by bacteria inhibits the protein synthesis is called Pseudomonas. Another one is EHEC. And then diphtheria toxin, I forgot to mention there, diphtheria toxin. Then PEDS, Shiga toxin. The mnemonic is PEDS. Okay, protein synthesis inhibitor cause பண்ற எல்லாமே, if you take just the in diphtheria again, pseudomembrane tissue damage is there, right? So that is what peeling of membrane. So all cell damage will be there. In case of invasiveness, ulcer will be there. Okay, so yeah, that's all about the Shigella. Complications again, HUS, hemolytic uremic syndrome, and the triad is same, RET, or you can remember like an MAT, microangiopathic hemolytic anemia, acute renal failure, thrombocytopenia. Okay, and yes, that's all about this. For this, no need of antibiotic. Okay, no need of antibiotic because it's purely toxin mediated, when the organism is producing toxin and cause manifestation, don't give antibiotics. It is self-limiting. Just treat symptomatically. If you really give antibiotic, it will just reduce the bacterial load the பண்ணுமே toxin will be there. So anyway, symptom will be there. Okay. The next bacteria is Vibrio. Vibrio, regarding Vibrio, it is waterborne. Again, rather than foodborne, waterborne. This will be your question. And infective doses should be higher. Why higher? Because it grows at the pH, acidic pH, it's nulla survive. For that, which means it should be higher enough dose to overcome the acidic pH. That is why high infective dose, number 2. Okay. And then it is waterborne, watery diarrhea. Remember, like waterborne, watery diarrhea. Okay. I'm not going to explain the classifications, it's already known. And the important points here is oxidase positive. Yeah, because 2 years back, this test picture of this oxidase was given and asked. That's why I'm again stressing oxidase positive is Pseudomonas and Vibrio cholerae. Okay. Treatment is again fluid replacement, no role for antibiotic because it is due to CT, cholera toxin. Okay. Activates the cyclic AMP, the same mechanism which you already know. Next species is Vibrio parahemolyticus. It is foodborne. And Vibrio vulni, V for wound. Vulnificus means wound infection. Vibrio alginolyticus, again wound infection. Okay, the usual skin level. This is ear and eye. Okay, and this is AG, gastroenteritis. This is how they'll ask you for just MRB level. And next is called Pseudomonas. Pseudomonas, you have to read in and about Pseudomonas because this is very notorious. Nosocomial or hospital acquired, everywhere it is there. Okay. Most common non-fermenting GNB. Usually, so far, what we studied all GNB, right? Gram negative bacilli, enteric pathogens, ellame GNB. They all basically ferment some sugar like glucose, lactose, adellame ferment pannu. But this Pseudomonas will not even ferment this lactose and all. Basic sugars break pannad. That is why they belong to non-fermenting GNB. Most common infection is Pseudomonas. Again, the virulent factor is just we discussed, right? It inhibits the protein synthesis. Protein synthesis is inhibited by the exotoxin A. This question you may get. Okay. Another one is it is producing green pigmented. Yes, that you know already. So green nail syndrome because of pigment only, green nail syndrome, and CSOM. Then burns patient, any SSI, it can cause ear CSOM, malignant otitis externa, post-operative SSI, and swimming pool dermatitis, endophthalmitis, and in lung, yes, lung most common cystic fibrosis infection is Pseudomonas. Again, you will get, and bronchiectasis, COPD, and nowadays VAP, ventilator associated pneumonia. Again, I said hospital acquired, right? Ventilator போட்டு 48 hours மேல வரதுக்கான வாய்ப்புகள் ஜாஸ்தி because of colonization. Again, COTI, catheter associated UTI, catheter போட்டுட்டு more than 48 hours அப்புறம் வரதுக்கான வாய்ப்புகள் ஜாஸ்தி because of hospital strains. Okay. And anti-pseudomonal drugs, definitely they'll give you if case scenarios are given, you may expect which of the drug will not be useful for Pseudomonas infections. They may ask you. Okay. And you have to know, yes, aminoglycosides like tactobra, amikacin, gentamicin, and cephalosporins, ceftazidime will work. Okay, ceftazidime, cephalosporin. This is the most commonly used drug for Pseudomonas. And combination drug, BLI combination drug, Piptas. Piptas is excellent drug. And CFS can be given. Carbapenem also can be used for this group of resistance. Carbapenem can be used. That is imipenem, meropenem, and all. Okay. Next is called Burkholderia pseudomallei. Okay, again, this is a rising case of pseudomallei. It's a bioterrorism agent. It's a great mimicker because it mimics like TB, In skin, it produces abscess. In lung also, it produces abscess. That is why it is called as great mimicker. Okay, milioidosis nale abscess formation will be there. Okay, and pseudo malay is over. Malay means horse. It's a zoonotic. Okay, skin infections will be the most common. If at all it spreads, it can cause lung infection. That's all. And another emerging NFGNB, next common to Pseudomonas is Acinetobacter. Acinetobacter species. It is again very notorious because they are always multi-drug resistance. The differentiating, appa idukku Pseudomonas kenna difference na, they are oxidase negative. Whereas Pseudo is most common. It is second most common. This is oxidase positive. Both are hospital acquired, responsible for hospital acquired infections. Okay. Acinato A, B, the most resistant species. If they ask you, answer will be Acinetobacter baumannii. Okay. And Hemophilus. Hemo means blood. Blood la vandu irukra factors, that is factor 5 and factor 10. Okay, where they are actually inside the RBC. RBC kulla irukum. Only if the RBC is broken. When it is happening, when we heat the blood agar, what heating of blood agar will cause the breakdown of RBC. So what is agar called as then? Breakdown of RBC, then that the agar is called chocolate agar. Agar romba heat agarla, if we pour blood, it becomes chocolate agar. That heat kills RBC, breaks down the RBC. RBC breakdown anale, factors will be released and 5 and 10. That will be easily acquired by the hemophilus and grown. That is how it is called as hemophilus. Okay, factor 5 and 10. And among all the types, capsular strains, Hib, H, Haemophilus influenzae, B, mattuna capsular strain, and it is responsible for, it is invasive. The other rest are A, C, D, E, up to F. They are non-invasive infections caused by. Okay. Among all the strains, serotypes, only the B are invasive. I said whenever it usually colonizes the nasopharynx, from the nasopharynx, I said capsule means meningitis. Again, it is example of acute pyogenic meningitis. Remember all the three capsulated organism. Strep pneumo, I said Hib, I already taught meningitis. Okay, you can remember like SHIN, shin. They all are capsulated. They all are capsulated invasive meningitis caused by. All are producing acute pyogenic meningitis. Okay, they all will colonize the nasopharynx. Same points. Okay, they all have vaccines. Capsular vaccines are there. Pneumococcal vaccine, meningococcal vaccine, Hib vaccines, conjugate vaccines. They all are conjugate vaccines. Capsular vaccines cannot be given alone. It should be conjugated with some protein. Okay, only capsule is different. Capsule is nothing but polysaccharide, right? So அது கூட நம்ம ஒரு protein add பண்ணோதான், it will be more immunogenic. அப்பதான் அதோட antibodies will be produced. Okay. Then only it can act as a T-dependent antigens. They all are, இது எல்லாமே same mechanism of pathogenesis தான். Okay. The next is called other types are there. HASEC. What is HASEC? Para-influenzae. Para-influenzae, Aggregatibacter, Cardiobacterium hominis, Echinella corrodens, Kingella kingi. இது எல்லாமே வந்து subacute bacterial endocarditis cause பண்ணும். Okay. The next is called Haemophilus ducreyi. Haemophilus ducreyi, STD, causing chancroid. Remember, it is soft chancre. When the word is called soft, obviously hard and hard chancre and again Treponema pallidum. Okay, this is syphilis. This is vascular, highly vascular. This is avascular. Avascular means no bleeding. Paler lesion. Here, touches, bleeds on touch. Okay, bleeds on touch. Ready to bleed easily, right? This is painful. Again, this is painless. This is GNB. This is spirochete. which is not given in, I didn't give in this format. If you want, you can take down. Then appearance will be like school of fish appearance. Okay, this will appear like a spirochete under dark ground microscope. Okay, so that's all about the Haemophilus ducreyi. They'll ask you with the picture. The next is called Egypticus. Egypticus, eye and skin. Eye la vandu conjunctivitis, purulent conjunctivitis. Okay, here, sorry, inge varum. Eye la vandu purulent conjunctivitis, skin la vandu Brazilian purpuric fever. Fever with purpura, rashes. Fever with rashes, Egypticus. Then next, Bordetella. Bordetella pertussis. Again, it is toxin mediated. Antibiotics won't work. Toxin mediated. The toxins are TAP, tracheal toxin, adenylate cyclase toxin, pertussis toxin. Okay, so these are the responsible for the whooping cough. Okay, which one will be help for addition, then agglutinin, and then inhibits adenylate cyclase, so increases cyclic AMP, and that is producing the mucus secretions. Okay, and then 3 phases are there: catarrhal CPC, catarrhal phase, paroxysmal phase, convalescent phase. Usually here வந்து symptomatic phase இருக்கும், here whooping cough phase, here recovery phase. Okay. In the questions regarding lab diagnosis, they'll ask you about the culture plate, mercury droplet appearance. Mercury droplet appearance. Okay, when the mercury drops, it produces oof like sound. You can remember like that, oof. When the mercury drops, oof like sound, whooping cough. Okay, and then I already said, and no role for antibiotics. Yeah, pertussis, whole cell. Previously, whole cell pertussis was used. But they produce more of CNS side effect. So then later on, acellular, only the toxin was removed from the entire cell and it was detoxified. That is toxoid. It was made into toxoid and then given. That is called a TDAP. Okay, nowadays it is given as a TDAP. Next, brucella. It's very easy. Brucella, it's like typhoid model. Brucella, it's one of the DD, differential diagnosis for FUO, fever of unknown origin. But the thing is, typhoid is not zoonotic, it is zoonotic. We finished typhoid already. This is FUO, but is not zoonotic. It is just waterborne. It is zoonotic. Upper history of some intake of improperly cooked or any ingestion of raw milk, unpasteurized milk, or direct contact with the infected animals and the history இருக்கும். Butchers அவங்களா இருப்பாங்க. Okay, again same macrophage involvement, here also macrophage involvement, but rather than the toxi, here no carrier. Yeah, that is what I want to say here, no carrier stage. But typhoid la vandu case and carrier were the sources. Okay, that is one thing you have to know, that both are responsible for FUO. Okay, and here fever, typical history of myalgia. Okay, here step ladder fever இருக்கும், typhoid. Step ladder fever, coated tongue, hepatosplenomegaly will be there. Muscle involvement will be very, very less. That is tiredness. Tiredness is different from myalgia. You may ask for myalgia here. Okay, and again hepatosplenomegaly will be there. This is again clinching diagnostic point. Okay, and then yeah, for typhoid, Vidal was the test, right? Tube agglutination. For brucella, standard agglutination test, SAT. Like both are examples of tube agglutination test. Okay, that is what you have to know. And here we'll detect the carriers. Here, who is the source? Animals are the source, right? So in animals, if the animal is infected by brucella, it can be diagnosed by milk ring test. Animal oda milk la and the antigens irukkan kandupidipanga. It's a serological test. It's not done nowadays. Better they are vaccinating the animals, or we have to maintain the hygienic proper things. Okay, proper boiling of the milk and maintaining hygiene. இதெல்லாம் தான் எடுத்துக்கணும். And the treatment is streptomycin. Streptomycin or doxy is the preference. Doxycycline or ceftro. If it is disseminated, they are going for ceftriaxone. Whereas here the AC cot or ceftriaxone will be the choice, or acetro. but fluoroquinolones are the reserved drugs. Okay, and then Legionella. Legionella is again a waterborne. Okay, waterborne, and Legionella means lung. Lung already risk factors. Those who are risk factors with lungs, like smokers, humidifiers from AC, right? Humidifiers. Idellana risk factors. So they are easily prone for this Legionella infection. So proper cleaning of AC, water cooler, all respiratory equipment should be done for Legionella. So in the history, you can think of Legionella pneumonia. And it causes two extreme, mild flu-like and severe pneumonia-like. Okay. The question from the lab ID points is, what is the selective medium? Buffer, charcoal, yeast, extract, agar is a selective medium. They will ask you this. And apart from that, nothing. Respiratory macrolides is the treatment. Okay. Nothing else will work out. For Listeria, I think I didn't say the treatment, right? Listeria, ampicillin. Ampicillin, better, it responds good with ampi plus genta. Ampi-genta combination will work out for Listeria. Legionella, macrolides. Okay. Next is called Gardnerella vaginalis. Gardnerella vaginalis is responsible for, namely, vaginosis. Vaginosis, history of vaginal discharge will be there. And there is a mnemonic called Amsel's criteria, which I have put up in the notes. A, B, C, D. Alkaline pH will be more than 4.5 if we check the pH of the discharge. And bad odor will be there. Clue cells will be there. Discharge will be like thin white discharge. If it is curdy white discharge, think of Candida. If it is greenish foul smelling discharge, think of Trichomonas vaginalis. Okay, it is a tropozoid form will be seen. See, it's a bacteria. It is a tropozoid. It is a fungus. Budding yeast cell with or without pseudohyphae will be seen. Okay. Twitching motility or jerky motility of Trichomonas vaginalis will be seen. All are STD. Examples of STD, vaginal discharge will be there. Candida is not STD. Okay, Candida will colonize the diabetes mellitus patients very often. So it is not actually STD, but it mimics like vaginitis. So we have to cover all the three, right? With one antiparasite, antibiotic, and antifungal under one coverage. Just a single tablet, it is available. Okay. So this is what about vaginal discharge, vaginitis. And the next is called H. pylori. Regarding H. pylori, they'll ask you about diagnosis, invasive and non-invasive. This is what always students get confused. Invasive, non-invasive methods. Okay. Culture. Yes, culture is the gold standard, but it's very slow grower. Okay, culture is very, very slow grower. And the non-invasive methods are urea, breath test, stool antigen. It is not routinely done usually. And invasive test, biopsy. They'll put biopsy and take out the sample. From the sample, they'll process. They'll put silver stain. Yeah, this is a question. Silver impregnation stain. Silver impregnation stain is used to identify the thin bacteria. Silver impregnation stain. Okay. And rapid urease test, bedside test, it's being done now. Rapid urease test, urea broth, they'll put the biopsy sample. The biopsy sample H. pylori, they'll break down the urea broth and with the help of the urease enzyme. So immediately it will give positive within 20 minutes. Urease test. Already we saw Proteus will give urease test positive. Cryptococcus will give urease test positive. Cryptococcus is a fungus. Okay, now I have told H. pylori. H. pylori is a rapid producer. Within 20 minutes, it will give positive. Okay. And yeah, next is called all Ellas. I think I have put up in the notes. You can see Legionella. We finished already. Francisella. Francisella is a tick-borne, which will cause tularemia. Okay, nodule, ulcer, and the tick bite. It will be the most common manifestations. Okay, ulceroglandular. Pasteurella, fever, ulcer, lymph node. Klebsiella granulomatis. Yeah, Klebsiella granulomatis will cause granuloma inguinale. Granuloma inguinale is responsible for genital ulcer. Okay, genital ulcer. Other organism causing genital ulcer. Chancroid, we finished already. Haemophilus ducreyi. Then Treponema pallidum. Then herpes. Okay, herpes, syphilis, Haemophilus ducrei, granuloma inguinale, they all cause ulcer, genital ulcer. Yes. Next is Yersinia. Yersinia pestis. It is rat, rodent borne. Okay, rat flea. The vector is rat flea, and it causes 3: bubonic, pneumonic, septicemic. Bubonic means at the site of the bite of rat flea, it causes eschar. So eschar, fever, lymph node. You can think of bubo. It is one of the differential diagnosis of again rickettsial infection. Eschar, fever, lymph node. Okay, so you have to rule out. Pneumonic means droplet inhalation mode. Okay, and it causes pneumonia. This inhalation of this pathogen is used as a bioterrorism agent. If they are untreated, they'll go in for septicemic phase. And regarding lab diagnostic points, they'll ask you, right, direct question. Wason stain is used for, it is very faint, okay, faint, poorly gram stained. So visible theriyadu. So adukavada special stain use panni paakranga, okay, and it gives the typical appearance of safety pin appearance. Safety pin appearance. Yersinia. Y is open, right? So you can look like safety pin appearance. Next, another species, Yersinia enterocolitica, Yersinia pseudo TB. Okay, they cause gastroenteritis feature, acute gastroenteritis feature. Okay, MTB. Regarding MTB, I'll just tell you the update because it will be covered in medicine. Lab diagnosis of MTB, that includes staining technique, Zeton staining, hot method, cold method is skinny on staining, fluorescent method is Oramen. Oramen is the stain used. This is second fluorescent stain. I'm just telling you. First one I said calcafluor, chitin for candida, right? This is Oramen, stains the cell wall in MTB. Okay, another stain is there, fluorescent stain, acridin, which you will get question, stains the DNA of Plasmodium, that is malaria. In this 3 organisms, we use fluorescent stain. Okay, and next, they are the, still, though it is age old, still it is the one used. Okay, and culture is not useful only for those who are not responding to the treatment, and in the last stage they'll do culture. And for diagnosing NTM, they perform culture. Okay, but not for the diagnosis purpose. The next is called, advanced one is called MGIT, that is Mycobacterium growth inhibitor tester. இது வந்து ஒரு liquid mediumல யூஸ் பண்ணி பண்ணுவாங்க. LJ medium is a solid medium, this is liquid medium. And serological test, no serology for TB. Okay, it is banned actually, no serology for TB. And the latest test is called CBNAT and Gene Expert. What is the advantage of this? It not only detects the TB, but also detects the drug resistance. Okay, what are the drug resistant genes? Rifampicin resistant gene. Okay, the gene name is RPOB gene. Whereas LIPA, line probe assay, this detects the RPOB gene, not only RPOB, and also INHA, isoniazid and rifampicin. This will be a question. CBNAT not only detects the pathogen, also detects the gene. This will be a question. Okay. Then another question is latent TB. Latent TB எப்படி கண்டுபிடிப்பாங்க அப்படின்னா, latent phase இருக்கப்போ you can detect the IGRAS. IGRAS is nothing but interferon gamma release. Actually in TB என்ன நடக்கும், macrophage overactivity இருக்கு. Yes, right? So this macrophage secretes the interferon gamma. Interferon gamma, when the load is high, can be detected in the blood by testing the IGRAS test. Okay. And yes, next one is M. leprae. M. leprae, you can divide into 2 groups, that is lepromatous leprosy, tuberculoid leprosy, with 4 features. Clinically, how do they present? Lepromatous leprosy will be multiple. Here it will be few lesions. It will be symmetrical. பார்க்கிறதுக்கு சிமெட்ரியா இருக்கும். இது வந்து asymmetrically இருக்கும். Okay, and then nerve involvement will be very late, whereas in case of tuberculoid, pure neurotic type will be more common in India especially. Okay, neuron involvement மட்டும் தான் இருக்கும், especially nerve involvement, that is early sign, thickening of nerve. Okay, ulnar nerve. And then immunologically, clinical differentiating point. Next is called immunologically, cell mediated immunity will be the predominant role in lepromatosis, whereas tuberculoid, humoral mediated immunity. When the cell mediated is gone down, humoral immunity will try to help. When the humoral immunity cell mediated immunity is normal or milder down ஆகும், this humoral mediated will be equally they are actually equal. Okay, immunity will be spared here, whereas here immunity is impaired. When CMI கீழ போறப்போ humoral exaggerator. What is meaning of humoral? Antibodies. Okay, so cell means cell involvement, direct T cell involvement. Humoral means antibodies. When CMI கம்மியா இருக்கப்போ antibodies will be highly elevated. That is why in case of any test like VDRL, any other test எது பண்ணாலும் அவங்களுக்கு it will give false positive. That is the reason for false positivity of other tests during immunocompromised condition, because of hyper gamma globulinemia. Okay, auto antibodies will be elevated because of compensation of the CMI and HS, humoral immunity. Okay, the next differentiating point is bacteriologically. Microscopically, if we see lepromatous leprosy, more number of bacilli will be there. That is multibacillary. Whereas here it is called paucibacillary. Okay, and histologically, histopath la paathom appadina, it is called foamy macrophage. Whereas here epithelioid macrophage, epithelioid type. So these are the differentiating points of lepromatous and tuberculoid. Next is called lepra reaction. Lepra reaction is one of the complication of leprosy. ரொம்ப நாளா leprosy இருக்கவங்களுக்கு lepra reaction வரும். Okay, and how it could be. Lepra reaction is type 1 hypersensitivity. Example, lepra reaction la two types are there. Lepra type 1, lepra type 2. Two type of reactions எப்படி differentiate பண்றது? Type 1 reaction, type 2 lepra reaction is example of type 1, 2, you can write it as 3 hypersensitivity and type 4 hypersensitivity. Okay, it is like anti-clockwise, right? 1, 2, 3, 4. Yeah, type 1 is example of type 4 hypersensitivity, which means what happens? Type 4 is what? Delayed type, right? Already இருக்கிற existing skin lesions வந்து newly get inflamed. Okay, that is the example of type 4. First, what is type 3 hypersensitivity? Anaphylactic, complement mediated, and immune complex mediated, delayed type. Type 3 is I, right? That is immune complex. What is immune complex? Antigen antibody deposition. Antigen antibody deposition எங்கல நடக்கும்? ஸ்கின்ல நடக்கும். Any organs, liverல நடக்கும், testis, இந்த மாதிரி organsல எல்லாம் the immune complex will go and deposit and causes lepra reaction type 2. So this is how it produces the lepra reaction. This complications. Okay, and it can be steroid can be given. Here it is clofazimine can be given. So this is the mechanism of lepra reaction. Okay, then next is called lab diagnosis. A slit skin smear can be done by using 5% of H2SO4 AFB staining can be done. It appears as bundle like appearance. Okay, cigar bundle appearance. Bundle இருக்கும். Tuberculosis வந்து தனித்தனியா இருக்கும், பட் இது வந்து bundle இருக்கும். Okay, cigar bundle appearance. Yes, it is intracellular pathogen nale it will not be able to grow in artificial medium la வளராது. So that is why we are going for animal culture, animal cell line medium or animal culture la valarum. Okay, the next organism is called RCM, Rickettsia. Okay, Rickettsia, recently many questions are being asked in Rickettsia chapter. Yes, Rickettsia fever, typhus fever group, spotted fever group. Okay, typhus fever group la Rickettsia typhi, Rickettsia prowazaki. 2 organisms are there. Rickettsia typhi, Rickettsia prowazaki. P for epidemic typhus. Typhi, endemic. Already we are endemic in typhoid fever, right? You can remember like that. So this is endemic typhus. This P is epidemic typhus. Endemic typhus is flea-borne. Epidemic, P for louse-borne. Okay, P, louse means pain, right? P for pain, Prowazaki, epidemic, louse. And they call, it is a milder form. It is severe form. They present with fever, rash, myalgia. Okay, fever, rash, myalgia. No eschar, no lymph node, nothing will be there in case of typhus group. Typhus group na ஏன் பேர் வச்சாங்க? இதுல இருந்து தான் டைஃபாய்டே வந்துச்சு. Because of fever, rash, myalgia. They just இது மாதிரி typhoid இருக்குல்ல, அது பேர் typhoid வச்சிட்டாங்க. Okay, later on it was differentiated. Clinically they look like typhus, typhus, typhoid. Okay, spotted fever na spots are there. So here matters fever, rashes, myalgia, eschar. Then lymph node, site of the bite, the regional lymphadenopathy. Pakkathula irukku lymph node enlarge aayirukku. So apart from this triad, you are going to add 2 more features. Okay, what are the spotted fever? 3 things are there. Rickettsia, rickettsii. Rick 2 times are there, right? Which means they're hard. 2 times in the hard. You can remember like hard tick. Then Rickettsia conori. Conori means Indian tick typhus. Rickettsia acari. Acari is the only thing will it causes pox. It is the only rickettsial infection transmitted by mite. Okay, matte ellame tick. Idu tick, idu mattu mite. Can remember like MAP, mite, acari, pox. Pox means what? Chicken pox, right? Idhila mattu eschar ku badila vesicular lesions will be there. Chicken pox, herpes. Herpes is always fluid filled, so vesicular lesions will be there. Rest of the thing are fever, rash, myalgia, eschar, lymphadenopathy. Okay, among them rickettsia is the most severe. The question is that only. Rickettsia is most severe. Prowazaki is most severe. Okay, the third group is called scrub typhus. Scrub typhus is Orientia shitsuka mushi. Is the screen visible?
Yes, ma'am.
Yes. The third one is scrub typhus, Orient Sutsuka musi. It is also transmitted by mite. Okay, the mite, name of the mite is called trombiculid mite, but that is not a question. Which form of the mite is infective? That is larval form. This is the question. The name of the larva is called chigar. So another will be chigarosis. Scrub typhus is also called as chigarosis. They won't ask you what mite and all. Trombiculid la question. Which form? Adult larva or larval form is the question. Okay, and there is a zoonotic tetrad. Small vegetations. Why it is called zoonotic tetrad? It is rich in all the things, right? Small vegetations and rodents, season, and mite also. So இது எல்லாமே ஒரு tetrad. Okay, இது எல்லாமே interlink ஆயிருக்கு. That is called scrub typhus. Okay. Next, again, I said already, right? RCM, Rickettsia, Chlamydia, Mycoplasma, they cannot be gram stained because of purpose. One is Rickettsia is intracellular. Chlamydia is again intracellular. So whatever the organism is intracellular, we cannot able to grow in culture medium like Newton-Tagger, Mekonkey. So they should go for either cell line or animal inoculation. Okay, but how to diagnose? This all can't be done in any labs, right? So how to diagnose? Serological tests are most commonly done for diagnosing this rickettsial infections. So what is the serological test? Again, older test, newer test. Older test which is not done abin pathona wheel felix. Okay, wheel felix test. Newer test la card test, ICT, ELISA. So this is the question. Okay, ICT, ELISA. And gold standard is immunofluorescent assay, but immunofluorescent assay is costly. Just forget that. Mostly done is IgM, ELISA dhan pandrom. And what is wheel felix test? It is one of the example of heterophil agglutination test, which will be discussed in immunology. Heterophil agglutination abina, hetero means different. different attracts, two different species attract it produces positive test. As a heterophil agglutination means what we are going to detect antibody because it is serology. Appa anti-rickettsial antibody kandupidikka we are using protease antigen. Okay, so two different rickettsia is different from protease. So two different species நம்ம combine பண்றப்ப antigen antibody reaction வருது. That is called Wheel-Felix test. Okay, Wheel-Felix test la 3 proteins are, this is again question, that is why I'm taking it very slowly. OX2, OX19, OXK. 3 protease strains are used, 3 antigen. OX2 antigen, OX19, OXK antigen of protease is used to diagnose rickettsial antibody. Typhus fever, spotted fever group, scrub typhus groups. Scrub sounds like K. So scrub typhus positive with only OXK antigen, whereas typhus group 19. Spotted fever group will be positive for 2 number rendume spotted fever. Okay, so this is how Wheel-Felix. It is example of heterophil agglutination test. This itself will be asked, which of the following is example of heterophil agglutination test? Okay, answer will be Wheel-Felix. Number 2, cold agglutination test done for mycoplasma. Number 3, Paul Bunnell test. I write it new slide. Okay, heterophil agglutination test, Wheel-Felix, cold agglutination test, CAT for mycoplasma. This is for rickettsia. Third is Paul Bunnell test for infectious mononucleosis, Epstein-Barr virus. So 3 இது மூணுமே unrelated species use பண்ணி test பண்றோம். That is why they call heterophil agglutination. Okay, this is not being done, but still questions are being asked for HAT. But the commonly done test for rickettsia is IgM ELISA. Don't forget that. Okay. Next is Coxiella burnetii. Coxiella burnetii is Q fever because it is query fever. Unknown causative agent. Previously, the Q fever kenna organism theriyadadnala they named it as Q fever. Later on, they thought that due to inhalation of dust from the soil which is contaminated with the feces of cattle. So who are the reservoir source cattle? Okay, you may get question from this. And what is Q fever abina? Initially it also presents like fever, myalgia. Later on, encephalitis, endocarditis, like systemic complications were more severe. Okay, systemic complications are more severe, and it is again a chronic manifestations. They are not acute, they are chronic manifestations. And yes, doxycycline is a treatment. Yeah, for rickettsia also again, rickettsia, Coxiella, எல்லாத்துக்குமே doxy 100 mg BD 5 to 7 days is the drug of choice. Okay, next we'll move on to, I think, chlamydia. Chlamydia, 3 species are there: Trachomatis, Psittaci, Nemophila. Trachomatis again 3 sub-zero groups, zero wars: A, B, BA, C, D2K, L1, L2, L3. Okay, this A, B, A to C affects the conjunctiva, cornea, causing trachoma. Trachoma, you all very know that it causes acute follicular conjunctivitis. Okay, and D2K strain causing genital chlamydiasis. Okay, genital chlamydiasis. From the pregnant women, it can cause neonatal infections via unhygienic delivery also. So in such way it causes neonatal conjunctivitis also. Okay, neonatal pneumonia. Genital வந்து urethritis, non-gonococcal urethritis. இது வந்து conjunctivitis. And L1, L2, L3, again it is the genital chlamydiasis. Example of genital chlamydiasis causing lymphogranuloma venereum. Lymphogranuloma venereum, name itself it is a vesicle granuloma. Okay, lymphobubo, granuloma, papule, mass, vesicle will be there. Okay, initially it starts as ulcer and then granule, papule, ulcer, vesicle, bubo, and the last stage will be elephantiasis because of lymphatic obstruction and elephantiasis. Swelling will be there. Okay, swelling of the genital region, vulval edema and all will be there. So that's all about the trachoma. Then சிட்டக்கில வந்து birds feces. சிட்டக்கி வந்து birds feces are the sources. From the birds feces directly transmits to human by inhalation route. No man to man transmission occurs. Okay, it causes mild flu like irukkalam or pneumonia like features irukkalam, severe. And autoimmune property is there. Autoimmune property because of antigen antibody deposition, it can cause periarthritis, encephalitis and all. But more autoimmune features are seen in chlamydia, pneumophila. This is the question. More autoimmune property is seen in pneumophila. Okay, mostly they are community acquired and causing atypical pneumonia. When it is community acquired, obviously man to man transmission is there. Okay, and yes, atypical means bilateral infiltration may be there. Okay. Yes, that's all about the chlamydia. And then mycoplasma. Mycoplasma pneumoniae. It is a one special bacteria which is the very smallest and lacks the cell wall. Okay, bacterial cell wall. I said RCM cannot be gram-stained, right? Why it cannot be gram-stained? Because they don't have cell wall. Okay, instead they have sterol component. Okay, the next property is most common will be respiratory manifestations. They have more autoimmune property. Autoimmune property means bacterial antigen binds with the host tissue. So because of that, antigen antibody develops and autoimmune property is there. Okay, adula vandu main pathina uveitis, arthritis, Steven Johnson syndrome and erythema multiforme idellame more common da. Okay. And here the question will be yeah, I said already, cold agglutination test. This is the MRB level question. Cold agglutination test. CAT. I taught you SAT, standard agglutination test for brucella. I taught you Vidal, typhoid, cold agglutination for mycoplasma, wheel flix for rickettsial. Okay, these are the things we studied so far. And most commonly done is ELISA. Cold agglutination test and all, no one is doing now. Most common is ELISA. Okay, again treatment, doxy, respiratory, macrolides. Yes. Next, spirochetes. Spirochetes, 3 are there: Borrelia, Lepto, Treponema pallidum. I think this is the last chapter in bacteriology. Okay, Borrelia. Borrelia 3 are there: relapsing fever, Lyme's disease, Vincent angina. Vincent angina you can compare with the Corynebacterium diphtheriae, like faucial pseudomembrane pathole, adu madri pseudomembrane. Here again, here also necrosis will be there, acute necrotizing gingivostomatitis. Okay, and then Lyme's disease vandu Borrelia Burgdorferi. Okay, Lyme's disease you can see like ring like feature, ada erythema migrans. Okay, erythema migrans. And relapsing fever means fever will be there and then febrile, then fever. It's called recurrent fever. Okay, and yeah, this is recurrentis, Borrelia recurrentis. Borrelia recurrentis, Burgdorferi, Vincent angina, Borrelia vincenti. These are the 3 species. Regarding lepto, yeah, lepto is most common bacterial zoonotic. Okay, that is lepto. It is also called as Wheel's disease. You all know that the epidemiology, right? 3 are rat, rice field, rain, everything you know that, right? And another thing is Fain's criteria. Fain's criteria is nothing but epidemiological criteria, that is 3 R, should be fulfilled with a clinical criteria, either fever, jaundice, or hepatorenal syndrome or Wheel's disease. And then laboratory diagnosis. Laboratory, what we can do? We can do dark-ground microscopy la leptospirochetes pakla, or culture. Culture is EMJH medium. It's a liquid medium. Lepto is aerobe. Okay, strict aerobe. அதனால மேல ரிங் வரும். அந்த ரிங் இஸ் கால்ட் அஸ் அ டிங்கர்ஸ் ரிங். ஓகே, பட் இதனால வந்து நம்ம லெப்டோட சீரோ வார் டிடெக்ட் பண்ண முடியாது. சீரோ வார் கண்டுபிடிக்கணும்னா மேட் டெஸ்ட். திஸ் இஸ் தி கோல்ட் ஸ்டாண்டர்ட் டெஸ்ட். மைக்ரோஸ்கோபிக் அக்ளூட்டினேஷன் டெஸ்ட் இஸ் யூஸ்ஃபுல் ஃபார் ஐடென்டிஃபைங் சீரோ வார்ஸ். ஓகே, there are more than 260 zero wars இருக்கு. அதெல்லாம் கண்டுபிடிக்கணும் மேட் டெஸ்ட் தான் போகணும். பட் இதை ஜீரோ வார் டார்க் கிரவுண்ட்லயும் கல்ச்சர்லயும் பண்ண முடியாது. ஓகே, this is also costly. Then what is the test being commonly done? I said it's the most common. What is the test commonly done is IgM serology, ELISA. So this will be your answer, IgM. Okay, IgM ELISA is the most commonly done test. Again, we cannot differentiate the zero war. Okay, then last is called Treponema pallidum. Treponema pallidum, syphilis. You all know that, right? 3 stages are there: primary, secondary, latent stage, or they may go for tertiary stage. The other category is congenital. Okay, so 4 manifestations you should know. Okay, and the primary is always genital. Okay, genital. We discussed ulcer already, avascular ulcer. And secondary, palms and soles rashes. Okay, rashes over the palms and soles. And tertiary, there will be gamma. Either patient go in for latency or patient will recover. Okay, from the latency, patient recover, or they may go in for tertiary. That is gamma, CNS, neurosyphilis, CVS, that is aortic aneurysm. This most serious finding, aortic aneurysm. Okay, congenital findings will be yeah, very classical congenital finding na, and the permanent changes, Hutchinson's அப்படின்னு சொல்லுவோம். இது வந்து previously asked questions. I just went through. When I went through, Hutchinson teeth was asked. Okay, and yeah, I think we finished serological test. Yeah, serological test la non-specific, specific. Again, I am saying whenever we say non-specific means we are not using the, see what we are studying, Treponema pallidum. Treponema pallidum oda antigens vachu anti-treponemal antibodies serum la detect பண்றோம்னா தான் that is specific test. Okay, but here we are not using non-specific test. We are not using treponemal antigens. We are using cardiolipin antigens, which is just extracted from the beef heart la irundhu extract பண்றோம், which has cross reactivity with the anti-treponemal antibodies. Okay, patient serum oda add பண்றோம். It is detected by 2 tests, RPR, VDRL. Okay, though TPIA immobilization test, TP3 treponema heme agglutination test, TPPA pallidum agglutination particle agglutination test, FTAABS most sensitive test question, fluorescent treponemal antibody absorption test. Though evlo specific test irundhalum we are going to do only RPR. Okay, VDRL again they are not being set up in many labs. Okay, VDRL is useful for neurosyphilis, but yeah, RPR pandrom non specific pannamo because there are a lot of advantages of RPR is there to monitor the treatment response. Okay, number 1. Number 2, early detection. Okay, number 3, after recovery of the patient, RPR will become negative. This is very important. Whereas if treponema specific antigens antibodies patient kulla irunduchna, they are protective, right? It will be still elevated in the patient serum even after treatment. That is how there are more advantages, but the disadvantage is biological false positive. It may become positive in many conditions, pregnancy, like other physiological conditions. That is a main disadvantage. Congenital syphilis la what is the diagnostic test? IgM. IgM, when we discuss immunology, I'll tell you about the specific features of IgM. So IgM, Treponema pallidum antibody will be diagnosed. So this is the serological test, more useful for congenital syphilis. I think we finished the entire bacteriology. We'll move on to parasitology next. Okay. Okay. Parasitology. So regarding parasitology, protozoa, we'll discuss one by one. First, protozoa and helminth. Protozoa are further divided into 4 groups: amoeba, flagellate, ciliate, sporozoa. Okay, sporozoa, sorry. Amoeba again 2. Intestinal amoeba, free living amoeba. Again, flagellate, you need to know this classification. That is how it will be very easy to discuss the life cycle. Intestinal flagella, genital flagella, hemoflagella. Okay, we'll discuss this first. See, I'm going to pick up cilia is intestinal. All the 3 intestinal. Intestinal amoeba, intestinal flagella, intestinal cilia. See, what is, you should know the names of entamoeba histolytica, intestinal amoeba. Giardia lamblia, intestinal flagellate. Balantidium coli, ciliate. Ellame intestinal. Whatever goes by ingestion route, it will reach the intestine, right? So, elladhukume ingestion is the route. Ingestion of what? The morphological forms are 2 types, cyst and tropozoid. Cyst form is an infective form. When it goes cyst form, it becomes cyst becomes tropozoid. Tropozoid will either invade or it transform into cyst. Okay. In the entamoeba histolytica, histolytic means or something like histology, right? Tissues. So, in the entamoeba histolytica, T form will travel to the tissue. Most common site will be liver. Okay. The rest of the entire cycle will happen in the intestine. Okay. So now it will be easy. First, cyst form enters, ingestion route, cyst form enters, cyst become tropozoid, tropozoid becomes cyst. Again, it can excrete in the stool. Simple. In the T form, tropozoid mattum entamoeba histolytica tissues ku pogudhu. Most common tissue will be liver. Simple, right? So they all are going to cause intestinal manifestations. What they are going to cause? They all are going to cause something like diarrhea or dysentery. In the EH, Balantidium coli will cause dysentery. Giardia lamblia will cause diarrhea. Okay, among them, the most invasive one is EH. Most common is liver. So the manifestation will be amoebic liver abscess. Okay, and the nature of the pus will be anchovy sauce pus. Already it is there in the notes. You can just follow anchovy sauce pus, and the site will be right upper lobe, superior posterior, which is the raw area right there. And in the intestine, it causes, when it causes dysentery, I said it is invasive. Invasive means ulcer produced one. Flash shaped ulcer will be the nature of entamoeba histolytica. Okay, the stool sample, I said cyst form or tropozoid form. If the tropozoid form is seen in the stool sample as a wet mount or motility, that is that indicates acute infection. Cyst irundhuchuna either chronic infection or carrier form. Okay, this is what we learned. And in case of giardia, how do they manifest? Giardia most commonly in children. Most common parasitic infection is giardia. Most common parasitic infection in children is giardia, and it produces fatty, frothy, foul-smelling, watery diarrhea. They are not going to invade. They are going to cause watery diarrhea. Okay, so that's all about the giardia. And yeah, next is called free-living amoeba. So what is free-living amoeba? They are not going to stay inside the host, which means they are somewhere outside in the environment. That is water. Okay, pond, lake, angala irukkum. 2 organisms are there. Naegleria fowleri, Acanthamoeba species. Naegleria fowleri, Acanthamoeba species. Renduthukkume history of swimming in water. Recent history irukano. Acanthamoeba mattum contact lens wearers history kekano, because they use the contact lens solutions, right, for cleaning. In that also, this parasite may go and survive. Okay, and mostly Naegleria fowleri vandu nasopharynx valiya nerve spread. Okay, nerve spread valiya, optic nerve valiya ulla po. Olfactory nerve, sorry, not olfactory nerve valiya ulla. N for N. Naegleria olfactory nerve neural spread reaches the brain and causes primary amoebic meningoencephalitis, which is 100% fatal. Whereas Acanthamoeba species causing GAE, granulomatous amoebic encephalitis, this is chronic slow progressive. Comparatively, they have good prognosis when with the Naegleria fowleri, which is poor prognosis. We may lose the patient once if they manifest. Okay. And you didn't ask me one thing, right? Naegleria fowleri, acanthamoeba, infective form, cyst form, diagnostic form. Before the cyst converts to tropozoid, the patient may we may lose the patient. Okay, so அங்க diagnostic form வந்து cyst தான் இருக்கும். Whereas acanthamoeba tropozoid will be the diagnostic form. Okay, then next, I think we finished this thing. We'll move on to the genital flagellate. Genital flagellate is Trichomonas vaginalis, which we already covered. The one point which I missed in the vaginatus is tropozoid is the only form for Trichomonas. There is no cyst form. Yeah, this was the question which was asked in TNPG when I verified. Tropozoid form மட்டும் தான் இருக்கு. அப்ப infective form tropozoid தான், diagnostic form tropozoid தான். Okay, is it clear? And here also greenish, foul smelling, frothy vaginal discharge. On speculum examination, there will be strawberry cervix because of intense inflammation, intense itching and inflammation. The redness will be there. That is how strawberry cervix is the findings. Okay, and vaginal swab eduthu jerking motility or twitching motility will be there. And next is called hemoflagellate. Hemoflagellate, two groups are there: Trypanosoma leishmania. Trypanosoma, again two species, Brucei and Cruci. Oh, okay. This is how I studied. You know what? This put it in alphabetical order. B first, C next, so that you won't get any confusion. B Trypanosoma B, that is Brucei. One second. I'll call you later. Okay. Trypanosoma brucei, bite of fly. Okay. Cruci, redweed bug. The auto inoculation by scratching the wound. Okay. If ஒரு wound scratch பண்றப்ப bug ஓட feces-ல அந்த organism இருந்து உள்ள போய்டும். Whereas here fly will come and bite. Okay. And for both of them, trypamastigotes. Actually, for the flagellate, இதுக்கு முன்னாடி வரைக்கும் cyst form, tropozoid form தான் படிச்சோம். இதுக்கு அப்புறம் வந்து நம்ம படிக்க போறது 4 form: amastigote, promastigote, epimastigote, trypamastigote. Okay, epimastigote எங்கேயுமே human formல இருக்காது, so forget about that. It won't be seen inside the host. Either amastigote, promastigote, trypamastigote. Now this trypamastigote, எங்க இருக்கு trypamastigote. So trypamastigote is an infective form for these two trypanosomes. Okay, and B for Brucei, B means, remember, like a brain. So brain la poi it causes sleeping sickness. And C for Chagas disease. Okay, so what is Brucei and the Chagas disease? Sleeping sickness. Okay, sleeping sickness means night time avங்களுக்கு sleep irukku. That is what nocturnal insomnia, daytime lethargy will be there. Okay, lab identification layum we are going to see trypamastigote. Infective form is also trypamastigote, diagnostic form is also trypamastigote. Chagas disease. Chagas disease at the site of the entry of the organism, skin plus chagoma. Here one thing I forgot, at the site of the bite there will be winter bottom sign. Winter bottom sign when the regional lymph node enlargement will be there, chancre. Along with that, chancre plus winter bottom sign. Here local edema will be there, chagoma plus Romanos sign. Subcutaneous swelling plus Romanos sign will be there. Okay, usually around the periocular field. This is the posterior cervical lymph node. This is ocular field. Okay, renduthukkume trypamastigote is the infective form. Okay, and then yeah, that's all about the trypanosomes. If at all they ask you, they'll ask you Brucei, there are two species are there again. Rhodescence, it's not need not to remember this. Gambiensis, remember R for rapid rapidly progressive, which means they are more virulent. More virulent is rhodescence. Okay, That's all. Next is called leishmania. Leishmania donovani. The name Leishman and Donovan ரெண்டு பேர் தான் கண்டுபிடிச்சாங்க. So the name it as Leishmania donovani and the identification point is LD bodies. Okay, they cause Kala Azar. Kala means black, right? Azar na fever. It's a Hindi term. Okay, black. So at the site of the bite of vector. So what is the vector here? Sandfly. Sandfly bite பண்ற இடத்துல there will be lesion. Okay, so black means what? Pigmentation. So I have put up 5 P's in the notes. One is called pigmentation at the site of the bite. Another one is called pyrexia fever. Another one is progressive weight loss. Weight loss இருக்கும். Another one is lymph node enlargement, progressive lymphadenopathy. Then pancytopenia. All the 3 RBC, WBC, platelet எல்லாமே அவங்களுக்கு கம்மியாயிடும். Okay, these are the manifestations of Kala Azar. What is the infective form? Infective form, what are the 4 forms I said? A, P, E, T. Amastigote, promastigote, epimastigote, trypamastigote. Trypamastigote for trypanosomes. This promastigote irukallaya. So we discussed 5P, right? The 6th P is promastigote form. Promastigote form is the infective form for leishmania. Okay, forget about the other forms. When the promastigote enters through the bite of sandfly, it turns to amastigote. Amastigote means they don't have flagella. It is called amastigote. If there are flagella irundada, they can move. It cannot move once. So chumma ஒரு இருக்கிற ஒரு ஃபார்ம் ஈஸியா நம்ம cell will go and engulf, right? That is macrophage. So in the macrophage will come and engulf the promastigote form, amastigote form very easily. So ஒரு macrophage குள்ள தான் you can see multiple amastigote. This is called LD bodies. Okay, if the organism is having flagella like promastigote, epimastigote, trypamastigote, easily they can escape from the cell. Okay, our நம்மளோட protective cells வந்து போய் அதை இது பண்ண முடியாது. Whereas macrophage will go and easily engulf the amastigote. This is called LD bodies, always seen inside the macrophage. Okay, so diagnostic form is amastigote. Infective form is promastigote. Okay, so that's all about the leishmania. The previously done test is called Napier's aldehyde test, Chopra's anti-molis test. இதெல்லாம் பண்ணாங்க. They are non-specific. Okay, what is a non-specific? They all are done to demonstrate the hyper gamma globulinemia. Immunoglobulins அவங்களுக்கு அதிகமா இருக்கும் அவ்வளவுதான். When this is why. What is the reason for hyper gamma globulinemia? When the organism is intracellular, cell mediated immunity will be the one. அதுதான் வந்து அந்த சைட்டுக்கு வந்து வேலை செய்யும். அப்ப என்ன ஆகும்? ஹியூமரல் இம்யூனிட்டி போய் காம்பன்சேட் பண்றதுக்கு ஓவர் ஆக்டிவ் ஆகும். So more antibodies will be produced. That is the reason for hypergamma globulinemia. Okay, whenever whatever test, serological test if we do, it will become positive, false positive for those kind of patients. Next, so most commonly done test அப்ப என்ன அப்படின்னா, it was asked recently, RK39 antigen. Okay, it is a specific antigen produced by Leishmania donovani. And that's all. Skin test is called Montenegro or Leishmanian test. It's example for type 4 hypersensitivity. Okay, then next I think last one, that is sporozoa. Sporozoa, there are again 2 groups are there. One is coccidian, another one is malaria. Coccidian la 4 are there. Cryptosporidium parvum, cyclo, iso. You have to compare these 3 and study. And the third, fourth one is called Toxoplasma gondii. We'll study first Toxoplasma gondii. Toxoplasma means cat. Okay, for remember that toxoக்கு 3 forms are there. Oocyst இருக்கு, tachyzoid இருக்கு, bradyzoid இருக்கு. Remember, oocyst will be seen in the cat feces la தான் இருக்கும். Okay, oocyst with spores அந்த மாதிரி இருக்கும். Tachyzoid is present shape. Tachy means fast replication ஆயிட்டே இருக்கும். So fast replication happens in the blood. Okay, blood la தான் இந்த tachyzoid form இருக்கும். Peripheral smear எடுத்து பார்த்தா tachyzoid will be seen. Bradyzoid means B for brady, body tissues la இருக்கும் bradyzoid. Brady means slow replication. So alla tissue குள்ள போய் lock ஆயிடும். Okay, so these are the morphological forms of Toxoplasma. And what are the roots அப்படினு பார்த்தோம்னா, so how to relate ourselves with cat feces? Are we going to eat cat feces? No, but there are chances of eating foods contaminated with cat feces, right? When we eat cat feces, oocyst is the infective form. So blood மூலமா எப்படி வரும்? Blood to blood transmission, and transplantation, vertical root. In the root lala, tachyzoid is an infective form. Okay, bradyzoid. Are we going to eat cat meat? No. While in the cat feces, while grazing, the cattle will eat the grasses which are contaminated with the cat's feces. So அப்போ oocyst மீட்டுக்கு போகும். oocyst cattle சாப்பிடும். cattle நம்ம சாப்பிடுவோம் மீட்டா. So due to improper cooked meat, the bradyzoids will be the infective form. So all the three are the infective form by three different routes. Okay, so how do they manifest now? Healthy individuals, it will not do anything. It is just self-limiting and mononucleosis like syndrome, fever, cervical lymph node, flu, the myalgia, it is self-limiting. Whereas immunocompromised patient, யாரெல்லாம் இருக்காங்க? HIV patients, blood transfusion or body transplantation பண்ணுவாங்க, solid organ transplantations பண்ணுவாங்க. HIV ல வந்து most common cause of seizure, that is toxoplasma encephalitis. Eye finding, most common cause of chorioretinitis. Most common cause of blindness in HIV is, yes, toxoplasma gondii. Most common cause of diarrhea in HIV, what? Watery diarrhea in HIV is Cryptosporidium parvum, which we are going to see now. Most common cause of meningitis in HIV is what? Cryptococcus neoformans, that is fungus, right? Most common cause of seizure, yeah, this is toxoplasma. Most common cause of chorioretinitis, blindness, again toxoplasma. Okay, so these are the things which affects the immunocompromised HIV conditions. Next, in organ transplantation, it causes pneumonitis, features like that. Whereas in case of congenital, if it transmitted via mother to baby, it causes congenital manifestations like the triad of brain la vandu calcifications, hydrocephalus, and eye la vandu chorioretinitis. They are 100% will be present in case of congenital toxoplasmosis. So peripheral smear, if we collect the blood, we will be able to see the blood liner, tachyzoids will be there. If we collect the biopsy from any tissue biopsy, bradyzoids will be there. But this oocyst form will never be seen in human samples. Okay. The older test is Sabin-Feldman test, which you may expect, but it's not done nowadays. Sabin-Feldman test is older test, but that is gold standard. Toxoplasma encephalitis, CT brine. If exudates, fundoscope, cotton only exudates will be seen. Okay, so that's all about the toxoplasma. Next is malaria. Plasmodium, 4 species are there: falciparum, vivax, ovale, malariae. The 4th species is knowledge, just forget about that. So you know the vector, that is female anopheles mosquito, and mode is called mosquito bite. The non-bite mode is called blood transfusion, vertical route by which trophozoites will enter. Okay, the triad of the malaria is fever, anemia, splenomegaly. Okay, and you know the reason for anemia is RBC is involved, right? Always RBC cycle. Because of RBC cycle and rupture, anemia will be there. And you need to know that the fever number of days, how evlo hours ka fever varuna. Falciparum and the newer one, I said no lessy, right? 24 hours once fever will be there. Okay, 24 hours once. That's the quatodian fever. Whereas vivax and ovale, every 48 hours once. That is called tertine fever. Okay, and malaria every 72 hours once. That is called quartan fever. Okay. What are the tests? Yes, complications. Always the most severe strain is falciparum. Okay, the species which affects the kidney and causing nephropathy is malaria. This will be a question. Rest of the thing, falciparum is responsible for all the complications. Okay, moving on to the lab diagnosis. Regarding lab diagnosis, if you take the RBCs, I'll just put up more RBCs. Okay, one with oval. Inside the RBC, if you see ring forms, this is nucleus, this is cytoplasm. Okay, it can appear as a double dot with a pale cytoplasm. So அது நமக்கு double dot தான் மைக்ரோஸ்கோப்ல பார்த்தா தெரியும். So that is called double dot appearance or headphone appearance. This is called acoliform. Acoliform na cell wall RBC oda cell இது மேல இருக்கும். That is called acoliform. Okay, இது எல்லாமே falciparum. Okay, multiple ring. ஒரு ரிங்கும் இருக்கலாம், multiple ringum இருக்கலாம். Multiple ring. This is falciparum. How to differentiate it from vivax? Vivaxல வந்து one second. Vivaxல, see, this is how it looks. Okay, see how to compare this with falciparum. This is vivax. Vivaxல, the size of the ring is very bigger. It occupies more space in the RBC, but the size of the ring is smaller. Okay, here this is nucleus, this cytoplasm. Opposite side is thicker. In case of vivax, here it will be even in size. That's all about the vivax. Whereas in case of malaria, it will be band form. In the madri band form la parasites irukku. This is band form. Band form is seen in malaria. Okay, another one is ovale. Ovale la vandu it will be like fimbriated madri irukum. Okay, oval shape la irundha plasmodium ovale. Okay, the next question what they will ask you is gametocytes. So what are the gametocytes? Gametocytes will be like banana shape in case of falciparum. So female gametocyte, male gametocytes. Female gametocytes means the nucleus will be compact and arranged in a center. Males means diffuse. Okay, so that's all about the morphological forms will be seen in thick and thin smear findings of all the plasmodium species. And I think we finished malaria. Protozoa is over. No, the next one is coccidian parasite. 3 coccidian parasites are there. Cryptosporidium parvum, Cyclospora, Isospora. Okay, they all cause watery diarrhea in HIV. HIV patients la watery diarrhea. Among them is the most common. Okay, the C. parvum resist even chlorination. Okay, chlorination layme adu resist pan, it survives. Okay, ellathukkume sporulated oocyst is the, we are studying under sporozoa, right? Sporozoa nalli sporulated oocyst irukum. Sporulated oocyst is an infective form. And this C. parvum, another exception is auto infection. The rest ellathukkume sporulated infection. Moonu layme auto infection is not seen with cyclo and iso, whereas unsporulated oocyst is the diagnostic form in case of C. parvum, whereas sporulated oocyst is the diagnostic form in the rest of the two. Okay, treatment is nitazoxanide, cotrimoxazole. That's all about the this one. The question here is modified AFP. Modified AFB positive, they'll ask you. Okay, plus or minus. Definitely this question you will get it. Okay, modified AFB means less 0.5% H2SO4. Reuse panitona modified AFB. Okay, I think next we'll move on to the Helminth. Helminth, regarding Helminth, it is divided into 3 groups. One is called cestode, trematodes, nematodes. Okay, cestode means tapeworm, trematodes means flukes, nematodes means worms. We'll discuss one by one. Cestode. For all the cestode, ingestion is the route. What I said, cestode and tapeworm. So you should know what are the tapeworm. Okay, tapeworms are beef tapeworm, pork tapeworm, fish tapeworm, dog tapeworm, rat tapeworm, nariya irukku. Ellathukkume ingestion is the route. Ingestion of larva. Okay, ingestion of larva. Oru tapeworm pattu ingestion of egg, that is Echinococcus granulosus. அது எல்லாத்துக்குமே ingestion of larva. Larva எதுல எல்லாம் இருக்கும்? Beefல இருக்கலாம். Beef, pork, fish, food with rat flea. That's a rat tapeworm. Okay. You should know the names also. What are the names? Beef tapeworm is Taenia saginata. Taenia solium is pork. Fishna Hymenolopus, Diphyllobothrium latum. D latum. The name la idan perusa irukum. Diphyllobothrium latum. Idan largest cestode. Okay. And இது maximum B12 absorb பண்ணும். பெரிய worm வந்து stomachல இருந்துச்சுன்னா it inhibits the absorption of B12. Another vitamin B12 deficiency is more common with fish tapeworm. Okay. And rat flea is smallest one. H. nana. This is opposite H. nana. Echinococcus is nothing but dog tapeworm. Upper ingestion of food contaminated with the dog feces. Dog feces la da அப்போ adult worm இருக்கு. அதனால எக் வந்து வெளிய வருது. அப்போ echinococcus granulosisல வந்து dog is the definite host. Human is the intermediate host. Intermediate host மட்டும் கிடையாது. They are dead end. Okay, which means life cycle cannot continue from human to dog. Okay, that is why human act as a dead end. The rest of the cycle, life cycle will continue. So intestinal teniasis. Both of them will cause intestinal manifestation, intestinal teniasis. Exception here is pork, that is Taenia solium. What I said, larva is the infective form. If the patient eats vegetarian or vegetables சாப்பிடுறப்போ வெஜிடபிள்ஸ்ல இதோட egg contaminate ஆயிருந்து அதை சாப்பிட்டோம்னா egg will enter into the human and becomes larva. Larva is always the motile stage, go to the brain, eye and muscle, will cause neurocysticercosis, ocular cysticercosis, muscular cysticercosis. Among them, neurocysticercosis will be the question. Why it is called cysticercosis? Because the larval stage of the pork is called larval stage of the solium is called Cysticercus cellulose. This is Cysticercus bovis. This question they will ask you. Larva name idukku padicha podu, and then idukku hydatid cyst idukku padicha podu. Okay. See, I repeat again. Usually the larva will be the infective form, whereas pork சாப்பிடாம vegetarians க்கு எப்படி வரலாம் neurocysticercosis na, if they consume the foods contaminated with the egg of the Taenia solium, inside once egg போயிடுச்சுனா egg ஓட next stage is larva. The larva develops. Larva has the property of motility, migrate ஆகி tissue க்கு போய்டும். What are the tissues? Brain, eye, muscle. Most common is neurocysticercosis. Most common manifestation is seizure. So CT MRI எடுத்து பாப்போம். Is it clear? அப்போ இதுதான் மெயின். இந்த வெஜிடேரியன்ஸ்க்கு இது மட்டும் தான் வருமானா கிடையாது. இந்த போர்க் ஈட்டர்ஸ்க்கும் ஆட்டோ இன்ஃபெக்ஷன் ரூட் மூலமா NCC வரலாம். So auto infection is seen with I am saying second auto infection. One is Cryptosporidium parvum, which we finished. This is Taenia solium. Okay. The next Diphyllobothrium latum I finished. There is vitamin B12 deficiency இருக்கும். Then diarrhea will be there. Diarrhea, vitamin B12 deficiency. H. nana again. Diarrhea will be there. Auto infection will be there. See, again I am saying third auto infection. Taenia solium, H. nana, C. parvum. Okay. So C, H. nana, Taenia solium. The மூணுலயுமே auto infection is same. Is it clear? What about Echinococcus granulosus? We all know very well, right? Echinococcus granulosus is a dog tapeworm. Where it goes? Habitat is dog ஓட intestine தான் இருக்கும். What is habitat? Adult எங்க இருக்கோ அதான் habitat. Adult இருக்கிற இடத்துல தானே egg வரும். Female male fertilization egg. அப்ப dog ஓட feces-ல தானே egg இருக்கு. Dog ஓட feces வந்து food மூலமா contaminate ஆகி உள்ள போகும். Egg turns to larva, right, inside the human. Human குள்ள larva. Most common site the larva goes is liver. And the disease is called hydatid disease. Okay. And the larva name is called hydatid cyst. Larva name is hydatid cyst. Disease is hydatid disease. Most common finding will be obstructive in nature. Okay. Fluid filled, obstructive in nature. And the madri obstruction manifestations da irukum. Okay. And ultrasound findings pathana water lily sign will be there. CT MRI la location, size, ethana cyst irukku, cyst kulla cyst, daughter cyst idella paakalam. Okay, and the technique used for treatment is PAR technique. I think we finished. That's all about the here one more point is man la idoda mudinjirum. Man oda liver if only it is only possible to complete the life cycle is only if the dog eats a human liver. That is not possible. That is why man is a dead end. இதுக்கப்புறம் continue ஆகாது. Okay, I think we finished cestodes. We'll move on to trematodes. Trematodes is nothing but flukes. Trematodes ரெண்டு route மூலமா வரும். One is called skin penetration. The other one is called ingestion. Skin penetration மூலமா வரது cystosomes. Cystosomes. Skin penetration மூலமா larva only can penetrate. Egg போய் penetrate பண்ணாது. Adult penetrate பண்ணாது. Larva மட்டும் தான் penetration property இருக்கு. Adultக்கு fertilization property இருக்கு. Eggக்கு infection property இருக்கும் or diagnostic property இருக்கும். Okay.
அப்ப அங்க SS பண்ணா
So cystosomes are cystosomes hematobium, cystosome mansoni, cystosome japonicum. Okay, these three are the more cystosomes, and his hematobium will go reach the bladder. Mansoni will reach the intestine, that is sigmoido rectum. இது வந்து ileocecal. So overall இது ரெண்டுமே intestineல தான் வரும். Okay, bladder feature infection வரலாம், obstruction வரலாம், cancer வரலாம். Again infection வரலாம், obstruction வரலாம், cancer வரலாம். Okay, ingestion of trematodes ல வந்து என்ன இருக்குன்னா, what we saw here, larval form. What is the name of the trematode of larva? That is cercaria. That is why in the skin enter the site la vandu varudhu cercarial dermatitis அப்படினு சொல்வாங்க. So either cercarial dermatitis first manifestation, whenever it reaches the habitat, அங்க போயிட்டதுக்கு அப்புறம் தான் larva adult ஆ மாறும் bladderல. So அங்கே வந்து infection features வரும். இதே another மீதி flukes ல வந்து ingestion of metacercaria. What are the other flukes you know? Lung fluke, liver fluke, gallbladder போகும், or intestinal fluke. Lung fluke is nothing but Paragonimus westermani. Okay, இது எப்படி வரும்னா crab சாப்பிடுறதுனால வரும். crabல இந்த larva இருக்கு. Okay, and ingestion liver fluke is nothing but Fasciola hepatica. Gallbladder is Opisthorchis viverni, Clonorchis sinensis. Intestinal fluke is Fasciolopsis busci. Fasciolopsis FA வரும். Fasciolopsis busci. Okay, busci intestine. Hepatica liver. Okay, இப்ப crab சாப்பிட்டு லங்குக்கு போய் லங்ல என்ன வரும்? Hemoptysis. This is called endemic hemoptysis. People like eating crab pickle and all, like in case states like Manipur and all, right? That is called endemic. This endemicity in particular site, hemoptysis. Hepatica means hepatosplenomegaly, biliary obstruction, liver cirrhosis வரும். இந்த manifestations இருக்கும். இதுல வந்து cholangitis, gallbladder is involved, cholangitis, cancer, cholangiocarcinoma will be there. Intestine க்கு போறப்போ ulcer, malabsorption, diarrhea, protein energy, protein losing enteropathy will be there. Okay, next here all larva is infective form, right? Metacercaria is a larva. எல்லாத்துலயும் larva தான் போகுது. So எல்லாத்துக்குமே egg will be the diagnostic form. Okay. Next nematodes. Nematodes too are there. Intestinal nematodes, tissue nematodes. Intestinal nematodes la, again it is possible by two routes. One is called ingestion of food contaminated with egg, or இன்னொரு route வந்து skin penetration. Skin, which can penetrate the skin? I said larva. So intestinal nematodes la, larva is also the infective form, egg is also the infective form. Remember, egg is eating, right? Eaten up by human. EAT. Enterobius vermicularis, Ascaris, trichurus. So இது மூணுமே egg is the infective form, and egg உள்ள போய் egg larva ஆகும், larva adult ஆகும், adult again lays eggs. Egg is the diagnostic form, infective form, diagnostic form. With the exception is the enterobius mattum auto infection. So what is enterobius vermicularis? Have you heard about enterobius vermicularis? Perianal, nocturnal, itching will be there. Perianal, what is the format? I think changed. This is okay. Enterobius vermicularis, nocturnal, perianal, itching. Most common in children, right? So what do? When they scratch, again with the unhygienic hands, they'll eat, right? So again, fecal-oral route is also possible. But what is the route we studied here? Eating only. Again, it enters, right, with the contaminated hands. So again, that is causing auto-infection. So 4 parasites we discussed for auto-infection. Number 1, C. parvum, H. nana, Tinea, Solium, Enterobius, vermicularis. Okay, so that's all. Auto-infection seen only with these parasites. Okay, then Ascaris lumbricoids, again, it is the Ascaris lumbricoids, the largest one. So more obstruction manifestation is seen with the Ascaris lumbricoides. I think everyone would have come across this case, I think. Okay, so it is responsible for malabsorption, allergy. Okay, all helminth infections IgE will be elevated, eosinophils will be elevated, which is responsible for allergic manifestations. Okay, and the helminth antigens are highly allergic. Okay, and then lungs this larva, Ascaris lumbricoids larva are highly motile. If they reach the lungs, it is called Loeffler syndrome. Okay, eosinophilia will be there. Lung manifestations, eosinophilia. The next one is called Trichuris trichura. Trichuris trichura, again, egg is the infective form. It causes bloody diarrhea, continuous passage of the blood. This is a whip form. Whip madri form. Okay, and rectal prolapse will be there. This is a complication. Rectal prolapse. This will be your question. And continuous bloody diarrhea, anemia will be there. Okay, that's all about these 3 parasites. Skin penetration மூலமா போறது 2. So larva enters by skin, right? That is strongyloids and hookworm. Don't confuse. Many of the students will say hookworm injection. No, hookworm skin penetration. That is ankylostoma duodenale and Necator americanus. Okay, at the site of the skin enters skin, they cause larva, cutaneous larva migrants. Okay, larva currents, cutaneous larva migrants. Okay, this strongyloids affects the immunocompromised patients. HIV patients la strongyloids varum. Okay, transplant panna patients la strongyloids varum. Other immunocompromised patients, they cause hyperinfection syndrome. Yeah, I forgot here. Here I remember, that is, this also causes auto-infection. So I'm adding one more thing, auto-infection in the list. Okay, strongyloids only in case of immunocompromised patients. And ankylostoma necator will cause cutaneous larva migrants, which is also called as ground itch. At the site of the larva entry, skin dermatitis and the features varum, urticarial rashes varum. And then when the adult worm reaches the intestine, it causes obstruction manifestations, malabsorption, iron deficiency, anemia. All these things will be the manifestations. And then tissue nematodes. The last part of the parasitology is tissue nematodes. Tissue nematodes na enna tissue first thing. Lymphatic the most questions will be asked, that is Wuchereria pancrofti. Wuchereria pancrofti. Okay, vector is called Culex. I have neatly put up all the vectors, what are the parasites and all. The thing is, you have to know the differentiating points. Wuchereria pancrofti, the lymphatic filariasis is the occult filariasis. 2 terms are there. Occult means what? Hidden. Lymphatic filariasis. So what is the form enters? L3 is the form enters into the human. Okay, L3 தான் போகுது by the bite of the vector மூலமா. L3 ஓட next stage is adult. Adult fertilization happens and mating occurs and it gives birth to larva. They are viviparous. இங்கெல்லாம் egg வராது. இது எல்லாமே viviparous group. L1 will be there in the blood. L1 தான் peripheral smear ல பாப்போம். L1 will be picked up by the vector. In the vector ல L1, L2, L3 development happens. Again L3 will come to the human. So L3 is the infective form. L1 is a diagnostic form. Okay. And then lymphatic filariasis L1 form தான் நமக்கு தெரியும். Okay, and இங்க microfilaria will be absent in the peripheral smear. Here it will be present. That is why it is called occult filariasis. And fever with lymphangitis is a feature. Fever with lymph node enlargement, inflammation of the lymphatics, and complications will be due to obstruction in nature. That is elephantiasis, hydrocele, chyluria will be there. In case of occult filariasis, it is also called as TPE, tropical pulmonary eosinophilia. And here, because of the microfilaria antigens, because of the release of microfilaria antigens, they are allergic. Okay, they are allergic. That allergic pulmonary manifestations is called TPE. Microfilaria will be absent in the blood. This is the question. In occult filariasis, microfilariae is absent in the blood. That is a question. Okay. Next, skin. Next tissue nematode is skin la varadu vandu onchocercus volvulus. அடுத்தது eye and subcutaneous site la varadu vandu loa. Muscle la varadu trichinella spiralis. So skin la vandu they causes skin manifestations, leopard skin pigmentation changes, and onchocerca also will affect the eye, river blindness. Okay, river blindness. Loa la vandu classical question, calabar swelling. Yeah, this is the question last year, last TNPG la previous question, that is calabar swelling. Don't confuse with Romanas sign. Romanas sign is seen in the Trypanosoma cruzi. Okay, clinically they look like same. Calabar swelling enga vena varala, engala bite irukko anga mattum da varum. Okay, calabar swelling. And yeah, in all such conditions eosinophilia will be there. Trichinella will affect the muscles. Myositis will be there. Muscle biopsy la larva theriyum. இது எல்லாத்துலயுமே ஸ்கின் ஸ்னிப் டெக்னிக், ஐ சப்கியூட்டேனியஸ் சைட்ல இருந்து பயோப்சி எடுத்து பார்த்தோம்னா diagnostic form is larva, infective form is also larva. Okay, and how to differentiate this larva? See, microfilaria oda picture diagram பாத்தீங்கன்னா L1 microfilaria oda tail இப்படி கொடுத்திருப்பாங்க. Okay, this is how it will be. See, we studied a lot of tissue nematodes, right? Wuchereria, Brugia, loa, onchocerca and all. How to differentiate with this picture? இதுல வந்து இந்த L sheathed, whether it is sheathed or unsheathed. It will be sheathed in case of LBW, loa, Brugia, Wuchereria. Okay, and the next thing you have to look at the nucleus. Nucleus arrangement tip வரைக்கும் இருந்துச்சுன்னா loa. Brugia மலையில வந்து ரெண்டு மட்டும் தான் இருக்கும். Only 2 nuclei at the tip. Okay, whereas here also sheath. In case of Wuchereria Bancrofti, the nucleus tip is free. Okay, free tip, 2 nuclei filled with nuclei. LBW alone sheathed. Rest of the nematodes, microfilaria unsheathed. Okay, I think we finished parasitology. Next, we'll move on to mycology. Okay. Mycology, 2 classification. One is called clinical classification. The other one is morphological classification. Clinical classification is skin, hair, nail, cutaneous, superficial infections. Subcutaneous tissue pochna, subcutaneous mycosis. And then systemic or deep. Systemic or deep. This is lung, most common one the lung. Okay, opportunistic infections, disseminated infections. Morphologically pathina 4 classification is there. Number 1, yeast. This is true yeast. True yeast, example Cryptococcus neoformans. Next, yeast like. The other one is yeast, the other extreme is mold or hyphae. Hyphae which was always runs parallelly. Okay, hyphae. Yeast like apina, yeast da, but it looks like hyphae, but they are not true hyphae. It gets constricted at the end. Okay, this is called pseudo hyphae. They are not true. Okay, they are yeast like, pseudo hyphae. This is seen in Candida species. Okay, the third one is mold form, which is septate hyphae. Either it is septate or aseptate. Septate, aseptate group. The 4th category is dimorphic fungi. I think I missed out this dimorphic fungi in the notes. You can note it down. Dimorphic fungus, which means they exist both in mold form and yeast form. At 25 degrees Celsius, 37 degrees Celsius, they are thermally dependent, thermally dimorphic. Temperature ke tamari mariko. Okay. The list is Histoplasma capsulatum, Blastomyces dermatitis, Coccidiomyces immitis, Paracoccidio species, Sporothrix schenki, Talaromyces marnafi. Previously, it was called as Penicillium marnafi. The newer name is changed to Talaromyces. Okay, so this is the list of dimorphic. I missed this in the notes. You can note it down. Okay, the next is called first one, Tinea versicolor. Tinea versicolor, which means famal nu solvom illaya. Pityriasis versicolor, other name is Pityriasis versicolor. The causative agent is Malassezia furfur. On Woods lamp examination, it appears as a golden yellow fluorescence. Okay, and it is not easy to grow. Okay, difficult to grow. Which one? Malassezia furfur difficult to grow. Why? Because they are lipophilic. It affects the sebaceous gland rich area. Engala sebaceous glands irukko anga mattum da irukum. Appo it is filled with fatty acids and lipids, right? So adanal da culture plate la sample போட்டதுக்கு அப்புறம் they'll pour olive oil. So it requires some oil to grow, and the morphology will be fried egg appearance. Okay, fried egg appearance. If we stain from the growth, இதுல இருந்து நமக்கு stain பண்ணோம், LPCB பண்ணோம்னா it looks like short hyphae and spore. Short hyphae, small hyphae இருந்துச்சு அப்படினாலே Malassezia furfur. Long separate hyphae na dermatophyte. So this looks like spaghetti meatball appearance. Okay, or banana grapes appearance. So that's all about Pityriasis versicolor. Then dermatophytes. Dermatophytes, the 3 species are there. Remember, dermatophyte affects skin, hair, nail. 3 species: Trichophyton, Microsporum, Epidermophyton. Okay, Epidermophyton. All the 3 affect skin. Okay, Epidermophyton, N means affect nail but not hair. Whereas Microsporum affects hair but not nail. This is the question they will ask you. Okay, very basic question. How to differentiate under microscope? First one is called Macroconidia. Microconidia will be there. Macroconidia will be very less in case of Trichophyton. It will be there. It will be plenty in case of Epidermophyton. Microconidia will be plenty in case of Trichophyton. Very less in case of Microsporum. Absent in case of Epidermophyton. So how to differentiate the shape of the Macroconidia among these 3? Trichophyton will be pencil shape, whereas Microsporum will be spindle shape. Spindle shaped Macroconidia is classically seen with Microsporum species. This was asked previous question. Okay. Epidermophyton like club shape, club or clavate shape. Okay, so that's all. Next, subcutaneous, that is spore. What are the subcutaneous mycosis? I said mycetoma, sporotrix, Schenke, chromoblastomycosis, rhinosporidium. 4 things we are going to learn now. Mycetoma, you know that is a triad, right? All are subcutaneous site. Okay, so ellathukkume there should be a history of trauma. Trauma illama adu subcutaneous ku pogave pogadu, skin taandi. So history of trauma must be there. Okay, subcutaneous swelling, granules, discharging sinus will be there. In case of mycetoma, the triad will be there. Eumycetoma, actinomycetoma, already we discussed this. Most common site is leg. Sporotrix la vandu, it is also called as Rose Gardner disease. Padichirpinga, Rose Gardner disease. Most common site is called hand. History of rose thorn prick will be there. Here asteroid bodies will be there. Asteroid bodies will be there. Okay, what is the one specific point I told about Sporotrix? That is dimorphic. Already we discussed this. Okay, chromoblastomycosis, again site is leg. Chromoblastomycosis la sclerotic bodies will be there, or otherwise called as copper penny bodies. The lesions will be cauliflower like growth, and mostly verrucous type. The question, verrucous type of lesion is seen in chromoblastomycosis. Sclerotic bodies are seen in chromoblastomycosis. This is the previous question. Okay, copper penny sclerotic bodies. Copper penny sclerotic bodies. And then rhinosporidium, the site is nose, sperules. Here the classical finding is sperules. Okay, history of swimming in the stagnant water. This is the question, stagnant water. If the lesion irukuna, large friable polyp will be in the nose. Okay, so that's all about the subcutaneous mycosis: mycetoma, sporotrichosis, chromoblastomycosis, rhinosporidium. Among them, rhinosporidium is Rhinosporidium, seaberry. Okay, Rhinosporidium seaberry is non-cultivable. Okay, and then we'll move on to systemic. Systemic fungus, what we discussed, blasto, coccidio, paracoccidio. 4 are there. Okay, this is endemic mycosis. Endemic in particular area. For example, this is endemic in Ohio River, Mississippi River. Okay, this is endemic in South America. This is blastomycosis is endemic in North America. And South America is and Brazil. Last one is in Braziliensis. Okay, histoplasma capsulatum, but not capsulated. It is intracellular, facultative intracellular. Okay, I said it is dimorphic. Question TB-like features. TB-like features. Okay, histoplasma microscopy finding again question, that is tuberculate macroconidia. Tuberculate macroconidia. We discussed 4 macroconidia, that is pencil shape, spindle shape, club shape, tuberculate shape. Club shape, tuberculate shape. Another shape is there, that is sickle shape. This is trichophyton. This is microsporum. This is epidermophyton. This is dermatophyte, superficial. Tuberculate histoplasma. Sickle shape fusarium. This was asked previously. Fusarium. Okay, sickle shape, fusarium shape. Okay. So TB, tuberculate histoplasma. Blastomyces dermatitis. Dermatitis skin. So it affects lung and as well as skin. Abscess. It produces abscess-like feature. Budding easel will be round in shape. Okay. Round budding. Broad base, round budding. Narrow budding will be there because dimorphic, right? But it's question like this is question. This gives figure of 8 appearance. Okay, broad based budding, figure of 8 appearance is seen in blasto. B. Coccidiomycosis. Coccidiomycosis bioterrorism agent. Okay, again, arthrospores, questions. Arthrospores are seen in which of the following fungus? Answer will be coccidiomycosis. Arthrospores. Paracoccidiomycosis, multiple budding. Multiple budding is cell. Like multiple budding. Mickey Mouse pattern. Okay, I'll pay the Mickey Mouse pattern. And this will be a question. Multiple budding is cell. Okay, next one is opportunistic infection. Opportunistic infection like Candida is the most common. Okay, then latest species is Auris, which is more resistant to all antifungal. Okay, again, speciation help pandra is the question. Speciation, recent question. Speciation help pandra agar is called chrome agar. Okay, routine, SDA, PDA, can't speciate. Okay, next is called GTT test, that is germ tube test, positive in Candida albicans. This phenomena is called Reynolds phenomena. Okay, Reynolds phenomena. Next, Cryptococcus. Cryptococcus again, it is the only capsulated fungus. When I say capsulated fungus, it causes meningitis, right? Meningitis risk factor is HIV, and the reservoir is pigeons droplets. Okay, pigeons droppings. Lung, first lung, then blood-brain barrier, and then brain. Okay, immunocompetent patient, self-limiting, immunocompromised patient, meningitis and HIV. Okay. Again, mucoid colonies. This question you may get. Okay, mucoid colonies is due to capsule. And what is the biochemical test positive? Urease test positive. Urease test positive. Okay. And yeah, that's all about this. And the latest question is beta 1,3-D glucan assay is not useful in which of the following fungus? Your answer must be either Cryptococcus or Mucor. The ரெண்டுலையும் தான் வந்து 1,3-beta D glucan assay will not be useful. It will be negative. Okay, so answer is that one. Next, Aspergillus. Aspergillus, 3 species are there: Fumigatus, Flavus, Niger. Fumigatus affects the lung, causes pneumonitis. Okay, pneumonitis, fungal ball, ABPA, allergic bronchopulmonary aspergillosis. Already ஒரு TB cavity குள்ள இந்த aspergillus grow ஆகலாம். Pre-existing TB cavity lesions-ல இருக்கும், or sinusitis. So lung and sinus will be most commonly affected, and the most virulent, most severe strain species in கேட்டா answer will be fumigatus. Okay, most severe. And Flavus Niger-ல less severe தான். And the Flavus affects mostly eye, keratitis. Niger, ear, black debris இருக்கும் earல, black debris. Okay, what is the otitis externa? Okay, so that's all about the Aspergillus. And Mucor rhizopus. Mucor rhizopus பொறுத்தவரை they belong to aseptate hyphae. This question they may ask you. Septate hyphae. So far, what are நம்ம discuss பண்ணுமோ, all the fungus whatever given in the book are septate except these two, rhizopus and Mucor. கண்ணு மூடிட்டு you can just close your eyes and then answer. Okay, Mucorல it will be like this. Septations will not be there, and rhizopus there will be rhizoids opposite to the development of the conidiophore. In the rhizoids in the rhizopus. Okay, rhizoids are seen in rhizopus species. Again, you can close your eyes and write the answer. Next question, what now they will expect you is post-COVID condition. Mucormycosis. If you get the history like this, or diabetic ketoacidosis, or starvation patient where the ketone bodies are elevated, and then patient is on desferoxamine in case of iron overload. This iron ketone bodies, they all are the attractants of the mucor. Okay, that is how they are becoming the risk factor for this fungus. And the most common type is called rhino-oculocerebral mucormycosis. Rhino means rhinitis, ocular eyelid edema will be there. Okay, edema of the conjunctiva, and then cerebral manifestations like coma, confusion. Okay, even death. Fatal. If untreated, definitely it is going to fatal, because they are, why? Because they are rapidly, this is the reason, angio-invasive. Okay, they are rapidly angio-invasive. They have that property. Because of that, we may lose the patient unless we started the amphotericin B. Okay, and yeah, I just said one newer point. That is 1,3-beta D glucan assay is negative in case of crypto and Mucor. This is very updated question, you have to know. Okay, and then PCP, Pneumocystis carinii pneumonia, or PJP, G0SC pneumonia. Okay, this is again indicator of HIV, causes infiltration in the lung. Okay, it was thought that actually first protozoa, because cystic tropozoid form that later on they have put it under fungus. Okay, cyst is the infective form. Special stain பண்ணி பார்த்தோம், Vomoris methylamine silver stain பண்ணி பார்த்தோம்னா அந்த cyst வந்து ரவுண்டா இருக்கலாம், or broke ஆகி இருக்கலாம், or இப்படி crushed ஆகி இருக்கலாம். அதுக்கு பேர் தான் crushed ping ball appearance. Okay, or cup and saucer, கப்ல saucer இருக்க மாதிரி இருக்கும். Okay, cup and saucer appearance. இதெல்லாமே findings of PCP, and the treatment is C, again C, cotrimoxazole. So இதுல தான் எல்லாமே C, cyst, cotrimoxazole, crushed ping ball, carinii pneumonia. Okay, next is called Talaromyces marneffi. The newer name is Talaromyces, again indicator of HIV, The only species which is what to say, immunocompromised is Telleromyces marnifi. Rest of the penicillium species are not indicator of HIV. Okay, and it is a dimorphic, which we already told. Dimorphic means mold form or yeast form. The mold form on the vesicle, it will the hyphae conidiophore directly phyalates and then conidia. There will be, whereas in aspergillus there will be vesicle and then phyalates and then conidia. Here absence of vesicle. This was previous year question. Absence of vesicles indicates penicillium or Telleromyces species. Vesicles irunduchuna aspergillus, otherwise it looks same. This gives the brush border appearance. Okay, brush border appearance. Oh, that's all about the fungus. I think we finished mycology. We'll move on to the virology. Okay. Second. DNA viruses are grouped into two: DNA viruses and RNA viruses. DNA viruses are first we'll discuss about herpes. Okay, herpes, HSP1 and then 2. 1 is above waist, 2 means below waist. Okay, 1 la vandu root is direct touch, direct contact, direct touch, whereas 2 means sexual route or vertical route. They have the property of latency. Okay, they have the property of latency, herpes. So above waist, that is HSP1, they have latency at trigeminal ganglia. Below waist, that is sacral ganglia. Most commonly HS1 will cause encephalitis. Okay, and site is temporal lobe encephalitis. This will be a question. Most common cause of temporal lobe encephalitis, HSP1. And in the eye, it causes keratitis. And what is the nature of the keratitis? Painful keratitis. Okay. And below waist, apart from this CNS manifestation, eye manifestation, they will cause mucosa. They affect the mucosa. Mucosa, gingivostomatitis. Okay, gingivostomatitis. And the fingers, it causes skin. Skin, it causes herpetic whitlow. They all have history of recurrence because of latency property. This is very, very important. Okay. Appears as like a blister lesion. The blister madri irukudallame. The property. Fluid filled lesions are always vesicles. Think of herpes. Okay. Next one is HSV2. HSV2 below waist. I said sexual route and vertical route. By sexual route, it causes genital herpes. Vertical route, it causes neonatal herpes. Okay, and genital route la vandu vesicles, ulcer. Vesicle leads to ulcer. Again, it is differential diagnosis of genital ulcer, which is painful, fluid filled lesion. And if we put up Zank smear, we can see multinucleated Jane cells. Okay, and neonatal herpes, all over the skin, rashes. All over the skin, rashes will be there. Okay, the next is called HHV3. Varicella zoster virus. That is primaria vanda, they are named as chickenpox. Okay, recurrence or reactivation ayi vanda, that is called zoster. Okay, usually chickenpox will be diffuse bilateral vesicular lesion. What I said, they have the property of latency. Latency means or a particular dermatome mattum involved. That is why usually it will be unilateral dermatome. Particular affected dermatome mattum na inge rashes, vesicular lesions varum. That is called zoster. Okay, zoster oda other features are there. Zoster ophthalmicus, eye la varum, or Ramsay-Hunt syndrome, facial nerve involvement. Most common post herpetic neuralgia, intolerable pain will be there. Oh, intolerable pain. And in case of pregnancy la vandichuna, yes, if it is 13 to 20 weeks means definitely there will be the fetus will be affected. That ends up in congenital features. Okay, if the mother affects 1 week before delivery, abdina they are safe, or near plus or minus 5 days of delivery na neonatal varicella. Viral shedding will be there. Okay, here damage will be there, congenital damage. Here antibodies will be there. Here viral shedding will be there. That feature ends up in neonatal varicella, where it should be treated with immunoglobulins and antiviral syrups. Okay, congenital varicella, we have no other go. Okay, and then next is called HHV 4EBV. Okay, EBV. It's also called as Kissing's disease. Oral contact, oral secretions, direct touch in the மாதிரி இதெல்லாம் போகும், especially via salivary secretions. Okay, and yeah, it causes infectious mononucleosis. IM, infectious mononucleosis nale fever, pharyngitis, exudative pharyngitis, lymph node. This is the triad of infectious mononucleosis. Okay, and the test is called Paul Bunnell test. Already we discussed heterophil agglutination test. And specific test are, this is the question, specific test are Epstein-Barr diffuse and restrictive antigens are there. Epstein-Barr and antigens can be detected. Otherwise, clinically, it can be diagnosed. Okay. The next, they have the property of causing oncogenicity property, oncogenic virus, which means what are the things? Burkitt lymphoma, nasopharyngeal carcinoma, Hodgkin lymphoma, non-Hodgkin lymphoma, they all are caused by Epstein-Barr virus. Okay, and then HHV5, CMV. CMV is the one which classically affects everybody. Immune good ah irukavungalukku affect pannum, immune bad ah irukavungalukku affect pannum. Good ah irukavungalukku vandichna, it is self-limiting. Mononucleosis like syndrome. Ipo paatha previously EBV features madiri dhaan irukum, but the test will be negative. Paul Bunnell test and specific test will be negative. Clinically, it looks like infectious mononucleosis. That is why they are mononucleosis like syndrome. Immune bad ah irukavungalukku yarukla irukum? Pregnant mother, HIV, organ transplantation, solid organ. Pregnant women again same, congenital cytomegalo features. Congenital features will be either the most common congenital manifestations which affects. Okay, torch like most common cytomegalo. What is the thing will be there? Chorioretinitis, ear, eye, and brain. Okay, chorioretinitis, ear learn sensory neural hearing loss. Chorioretinitis, a triad of congenital manifestations where calcifications will be there. Okay, the HIV patients learn again chorioretinitis. Solid organ transplantation, pneumonitis. Okay, again, most common viral infections seen after the transplantation is cytomegalo, most common. And the HND finding is owl-like appearance. Okay, the next is called HHV6. HHV6 also asked once, that is sixth disease, roseola infantum, fever with rash, mostly in children. Roseola infantum, exanthema subitum. Okay, the next is called HHV8. HHV8, Kaposi sarcoma, HIV patient. Okay, these were previously asked questions. And next is called Parvo B19, classically affects the RBCs. RBCs, good affect already RBCs fragile or kammiya, less RBC affect. But it's good simple anemia. Okay, already weak irukavanga. Example, transfusion. Okay, and transplacental and the condition lala hydrops fetalis, more damage. Hydrops fetalis, transfusion, transient aplastic crisis will be there. Okay, pure red cell aplasia will be there. Okay, otherwise it causes fever with rash, slapped cheek appearance. This question was previously asked, slapped cheek appearance. Okay. The next is adenovirus. Adenovirus have given you the entire serotypes and infections caused by them. And the question asked from adenovirus was EKC, epidemic keratoconjunctivitis. What is the serotype responsible for? EKC caused by most commonly adenovirus. And that is 18, 19, 38, 19, 37. Okay. And yeah, next is called, what is the serotype responsible for diarrhea? 41 and 42. Adenovirus. Okay. These two questions were asked previously. And then papilloma. papilloma HPV. The questions asked from papilloma, what is a high-risk serotype? High-risk serotypes are 16, 18. Recent question, 16, 18. So in vaccination, that is, vaccination covers even the low risk. Low risk are 6 and 11. All the 4 strains should be covered. That is called quadrivalent vaccine. Okay, quadrivalent vaccine. And the strain name is Gardasil. Okay, and it's a subunit vaccine. Next is called pox. Pox is smallpox, which is eradicated. You won't get any questions from that. But molluscum. Molluscum again, the question asked was pearly white or pink to white. Pearly pink to white with central umbilications. The lesion will be like this. Central umbilications. Okay, this is called molluscum, and molluscum bodies will be there if we take HND test from the biopsy. Okay, the next is called after transplantation, even the BK virus from the polyoma group. Okay, polyoma group will cause after renal transplantation will cause nephropathy. Okay, it was the one previously asked. Then RNA virus. Among RNA virus, first we'll discuss Picorna viridae. Picorna, the name itself it is a Picorna, pico RNA. P for positive sense, icosahedral RNA group. Okay, the two group. One is called entero, the other one is rhino. Entero means feco-oral route. The name itself it is a feco-oral route. Rhino means respiratory route spread. Rhinovirus, which will cause usually the respiratory manifestations. Feco-oral route. We are going to study 2, polio and Coxsackie. First, polio. Polio, the question asked was most common type causing VDPP. Okay, that is type 2. VAPP is type 3. What is VDPP? We will come back later. Next, we'll come later on that. And the route is feco-oral. Okay, feco-oral route. And it affects it causes what? Descending, this is a direct question, descending asymmetric AFP, acute flaccid paralysis. Okay, and poliomyelitis is the manifestations, yeah, with the muscle wasting and next one, this serologic, lab diagnosis. In that, direct immunofluorescence antigen test. It's helpful for diagnosing one. Okay, otherwise rectal swab we can detect this carrier patients and all. Okay, the next thing is, what is the differentiating point between VAPP, VDPV? It is, just listen carefully, vaccine associated paralytic poliomyelitis, which means it is a disease. Here, vaccine derived poliovirus, it is a virus. Okay, how the disease can come? Once both are seen with only OPV vaccine, not with IPV. The vaccines will be discussed, I think, in community. I'm not going into that. So, but this is the disadvantage of the OPV, VAPP and VDPV. So, once OPV, it's attenuated one. Okay, it virulent on the avirulent. Once attenuated OPV is taken, inside the intestine, it may get virulent. Okay, once the neurovirulence property the patient may get poliomyelitis. This is called VAPV, mostly seen with third serotype. Whereas VDPV, what is the aim of OPV? It's giving mass immunization, right? That strain will be shed in the stool and produces the community, protects and produces the immunity to the entire community. This is a herd immunity. That is the aim of the mass immunization, right? This is how it spreads. In the vaccine, the attenuated OP is given to few population. The vaccine is transmissible from one person to another person. And during the vaccine transmission, the genetic mutation might happen. That is called VDPV. Upon the virus and the vaccine or a property will be reduced while during transmission. Okay, after giving it as a vaccine. But this vaccine both are the side effects of OPV. Whereas this VAPV and VDPV are zero chance in case of IPV. Okay, so late updated in the questions will be, you may expect. The next is called Coxsackie. Coxsackie, 2 types are there, A and B. A is responsible for HF and D, hand, foot, mouth disease. Okay. And Aseptic meningitis. It was asked once. Aseptic meningitis caused by Coxsackie B. Especially B1, B2, B6 is the more common. Even HFMD the more common. Okay. And then rabies. Rabies. Again, rabies you have to know two things: G protein, N protein. G protein is responsible for pathogenesis, highly antigenic, right? Which means they are able to produce antibodies. Because of that property, it is used in vaccination. Okay. And this is capsid protein. This is not used for vaccination. No role in pathogenesis and vaccination. These differentiating points. And then it's a bullet-shaped virus. Okay. There are 3 phases. First is called prodrome phase, a neurological phase. Last is called paralytic, neurological or paralytic. Then death. Okay. So mostly in the neurological phase, they'll present with the fever, anorexia, wound site paresthesia, mostly with the hydrophobia, anxiety, restlessness. Okay, paralytic phase will be seen in partially immunized patients. Okay, partially immunized patient. Anyways, later on they'll go for 3rd stage, that is coma and death. Okay, and regarding lab diagnosis, ante-mortem, post-mortem. Ante-mortem lab, corneal impression. Okay, corneal impression. Best site abin pathona, best sample abin pathona, hair follicle. Hair follicle. Idhula enna test panna mudiyum? Either we can detect the antigens, only antigens, or we can go for any culture and all. But idhella not possible. Only antigen detection. That is direct immunofluorescence. This is the gold standard test. Okay, another classical question what they'll ask you is Negri bodies. Negri bodies is one of the post-mortem tests which is done with a brain biopsy. Okay, in the question they'll ask you direct immunofluorescence. They'll ask you what is the best sample. They'll ask you, and the most common site from the brain is cerebellum. This question they'll ask you site. Best sample is hair follicle from the nape of the neck. Okay, and regarding the immunization, again, categories they will ask you. What are the categories patient will come and what is the step they will do? 3 categories are there. Yes. First category, touching and licks on the intact skin. Category 1 means intact skin. When the intact skin means nothing will happen. Okay, no need of doing anything. If the dog bites, bites but bleeding, like nibbling, minor scratching, what to do? First, local care, immediate vaccination. Only vaccination. Vaccination means active vaccination mattu kudutha podum. No need of IG, immunoglobulins. Okay, whereas 3rd category, that is bite, big bite, bleeding, multiple bites. If the dog is known rabid, I think previously this was asked, I think. Okay, so category 2 ketturnanga. Category 3 la enna vandalum first immediate vaccination. Okay, rabies, immunoglobulin, human rabies, HRIG, and then local treatment. These are the category 3, 3 steps. Category 2, 2 steps. Category 1, none step. This is how you can remember easily. Okay, and yeah, nowadays post-exposure prophylaxis is given as a 3 dose, day 0, day 3, and day 7. Okay, and yeah, that's all. Then Arbo, I have put up only the important viruses which are endemic in India. One is called in India. It is not there is yellow fever, not in India. Okay, yellow fever. It is again transmitted by Aedes. Aedes also transmit the dengue, chickenpox, Zika. Aedes is responsible for dengue, chickenpox, Zika, yellow fever. Okay, and yellow fever, jaundice will be the feature. The latest question was Taurus bodies. What is the inclusion body? Taurus body. 2000 FMG 2022 question is latest June question. Okay, Taurus bodies, and then vaccine is 17D vaccine. 17D vaccine is a live vaccine, so contraindicated in pregnancy patients and other immunocompromised. And then it is allergic to egg. It is allergic to egg allergy. It is contraindicated in egg allergic patient. What are the other vaccines contraindicated in egg allergic patients are flu vaccines, that is inactivated rabies vaccine, which is not given nowadays. Another one is flu vaccine, again inactivated vaccine, which is egg derived. It's egg derived or allergic to contraindicated in egg allergy patients. Okay, next is called chikungunya. Chikungunya, fever, arthritis, okay. But the latest question what you may get is, what is the mutation happens in chikungunya? Okay, the Aedes aegypti is the same vector. But what is the reason for mutation is new vector, Aedes albopictus. You may get this as question, albopictus. Okay, and what is the reason for mutation is E1A226V. Okay, the alanine is replaced by valent, but it is the reason for emerging, re-emergence. These are the reason. One is new vector, another one is mutation. Okay, the next is fever arthritis group. Okay, what is the best method? IgM, LSA. Okay, the next is called dengue. Dengue, again, clinically it will be discussed in medicine chapter, but what I'm going to teach is lab diagnosis. Up to day 1 to day 5, you can test for NS1 antigen. After that, IgM antigen. Okay, this will be a question. Fever with warning sign, without warning sign, whatever it is, but the blood sample is given up within 5 days of fever, you can check NS1 antigen. After that, IgM antigen. Okay, after 3 months, IgG antibodies can be checked. Okay, and yeah, that's all. And then Japanese encephalitis, regarding JE, it is the most common viral epidemic encephalitis. Okay, so on the entire village or many group of people may get this encephalitis. So that is why epidemic. Okay, and then vector is called Culex, not Aedes. This is called Culex. Okay, JE, Japanese encephalitis. So encephalitis group, and humans are dead end. Humans are dead end. The cycle cannot continue from mosquito to human, human to mosquito because of the less viral load. Okay, unlike dengue, mosquito, human. Again, if the mosquito bites an infected human, it can go and spread. But here it is possible, but because of less viral load, it cannot transmit. Okay, and here most acute encephalitis stage vaccine is live vaccine, that is SA14-14-2. Okay, and next is called KFD. KFD is called monkey's disease. Reservoir was vector is Hartic. Monkeys host are the actual host are monkey's disease, and vector is tick. Okay, forest lala hard ticks will be there. Okay, you can remember like that. Rather than mosquito, ticks will be there in the forest. Okay, and humans are the accidental host. Again, fever, rash. It also belongs to encephalitis group. So encephalitis group la JE, KFD. Fever with rash group la dengue. Fever with arthralgia. Zika varum. Okay, idhula chickenpox, chikungunya. Fever with arthralgia, chikungunya. Okay, next is called Zika. Zika, again the same vector, that is Aedes aegypti. Zika actually was thought to be either by Aedes aegypti mosquito bite, then mother to child congenital manifestations, that is microcephaly. You may get this as question, microcephaly. Okay, and mosquito bite fever with rash like dengue. And the serology diagnosis is IgM. Mostly IgM serological tests are helpful for arboviral diagnosis. Okay, the next is COVID. Okay, COVID belongs to beta family. There are alpha, beta, gamma, delta subtypes. Coronavirus belongs to beta subtypes. Okay, SARS-CoV-2, MERS-CoV-2. And the mode of transmission is droplet. Yes, we all know that very well, droplet. And the antigen is S spike. Okay, spike protein. Okay, it is the one which is going to bind with the ACE ACE2 receptor. Okay. And for binding of this corona, idu bind avuna, first SPE break out. This is helped by TM transmembrane serine protease 2. Okay, this is from the host. Once this breaks the S protein from the entire virus, proteolysis occurs. After that, this S protein goes and binds the ACE2. Okay, once this binding happens, destruction of the pneumocystes. Pneumocystes are pneumocystes are destroyed, and then type 1, type 2 pneumocystes are damaged. Type 1 helps for the actually diffusion of the gas. So once that is affected, hypoxemia occurs. Type 2 helps for the surfactant secretion. So once that is affected, loading difficulty in breathing occurs. Okay, accumulation of the fluid. Next, manifestations. Yeah, fever, rhinitis, sore throat, URI manifestations. And if severe, when the disease is severe, it goes for hypoxia. Critical means respiratory failure, multi-organ failure. Okay, lab diagnosis, throat swab or nasopharyngeal swab. Okay, throat swab or nasopharyngeal swab. Either we can go for serology test. Serology tests are not used nowadays. It was because of multiple false positivity, that is ICT, or molecular RT-PCR. Or we can go for electron microscope. We can see the corona, that is sun ray, petal-like appearance and all, or culture, cell line culture. Nothing will be helpful for diagnosis. Acute diagnosis, molecular. Previously, serology was done, but it is stopped by the ICMR. Okay. The next is called vaccines. Regarding vaccines, RNA-based vaccines, that is Pfizer, Moderna. Protein subunit, that is protein part alone was taken and attenuated and given, that is called Novavax. Okay. Then recombinant viral vector, recombinant vaccine, viral use panni combine panni kudutanga, that was Covishield. And then inactivated whole cell vaccine, that is Covarix. Okay. Yes, the next is called Myxoviridae. Myxola, again 2 groups are there, ortho and paramyxo. Orthomyxo, example is influenza. Paramyxola, para-influenza, measles, mumps, Nipah, Hendra. Okay, they are zoonotic. Okay, here influenza antigenic variation will be there. What is antigenic variation? Shift and the drift. Antigenic shift and antigenic drift. Okay. Antigenic shift and antigenic drift. Shift means due to genetic reassortment. Shift drift means point mutation alone. Okay, that is called antigenic drift and shift. So next is called what is the transmission occurs. So first in birds there are alpha 2,3 sialic acid receptors where it was found in the bird intestine. Okay, from birds, humans. Okay, it's called avian flu. Human strains. In human, they have alpha 2,6 receptors, and especially in the upper respiratory tract. That is why they manifest with the upper respiratory infections. Okay, in the rend strain mix agi pigla poch. Okay, pigs because they have both the sialic acid receptor alpha 2,3 and alpha 2,6 receptors. Since both are there, they can attract all the strains, and mixing happens in the pigs, and they are susceptible to both human virus and avian strain also, and that produces the newer strain, that is swine flu, that is H1N1. Okay, initially H5N1. Okay, this is how the transmission history. And then clinical feature, flu-like illness. Yeah, mild. So URI, rhinitis, fever, cold, a common cold like features. Only URI. Most common extra pulmonary in pata, myositis. Okay. Secondary bacterial pneumonia. Most common organism is Staphylococcus aureus. Okay. Lab diagnosis is again molecular remains the gold standard. RT-PCR. Okay. Egg inoculation also can be cultivated. That is, the egg part is used for amniotic fluid and allantoic fluid. Amniotic fluid A, B, C, all the 3 types were grown. Allantoic only A. This was asked in the previous question. Okay. And treatment is YAM2 blocker, NA blocker, matrix blocker, uramidase blocker. This is amantadine. This is Tamiflu. That is oseltamivir. Okay, 75 mg. Okay, the next is para-influenza. Para-influenza, we are going to study measles, mumps, but rubella. Rubella doesn't belong to this mixo. Since the clinical manifestations mimics like measles and rubella, they have. I'm going to teach you under the same chapter. Okay, measles. Measles, most common cause of childhood rash. Okay, this is going to cause parotitis. Measles, mumps, rubella, fever with rash. Incubation period is 10 days, 20 days, 14 days. Upper 10 days na day 10 fever varum. Okay. After 10 days kapron, 12th day Koplik spots. Day 14 they develop rashes behind the ears. Okay. Fevers, Koplik spots, rashes. Koplik spot means what? They'll be there in the buccal mucosa. Okay. Buccal spots. That is the triad of measles. Mumps means parotitis, and usually it will be bilateral. So fever, day 21 fever will be there, and followed by bilateral parotid swelling. Okay. And the complications will be oophorytis, aseptic meningitis, rubella, again fever. Day 14 fever will be there. Fever followed by rashes, followed by even the rashes with fever with lymph node. Okay, this is again a triad of rubella. And uvula Forsheimmer spots. Forsheimmer spots. Whereas Koplik spots is in measles, Forsheimmer spots is in rubella. Okay, Forsheimmer spots, rubella. Then congenital rubella syndrome. Congenital rubella syndrome, that is a triad. Again, ear, eye, heart. Okay, ear, sensory neural hearing loss. Eye cataract. Heart patent ductus arteriosus. Okay. The next is called slow virus disease. Slow virus disease. Prions. Okay, prion slow virus disease mostly affect the CNS, longer incubation period. Okay, and CNS progressive multifocal encephalopathy. Kuru. The name of the disease are Kuru. Creutzfeldt-Jakob disease. Fatal familial insomnia. Okay, usually the prions cannot be easily that much killed by routine sterilization methods. It has to be killed by special methods by increasing what I said previously. In any case of blood spill, 1% sodium hypochlorite, right? 1% sodium hypochlorite, 20 minutes. But in case of prions, if you want to kill prions, that is 2 hours. Okay, this is a question. And autoclave, routine autoclave is 121 degrees Celsius. But here, 134 degrees Celsius for 1.5 hours. Okay, the rendume previous year's question. Prions will be killed by. Next, viral diarrhea. Viral diarrhea, most common causes rota. Okay, most common causes rota in children, especially. Rotarix vaccine is available. It is a live attenuated vaccine. 2 doses can be given, 6 weeks, 10 weeks. Okay. and adenovirus 41 serotype, and norovirus, astrovirus. Okay, then Ebola virus. Fruit bat is a reservoir. Next virus, fruit bat is a reservoir. It causes fever plus rashes, fever with hemorrhagic rashes. Ebola virus. Okay, shock and then later on death. Ebola. The other category is Marburg. Marburg also the manifestations are similar. The next important virus is hepatitis and HIV. Hepatitis. Among the 5 types of hepatitis, HEV மட்டும் தான் fecal-oral. Okay. Whereas HBV, HCV, HDV இது எல்லாமே blood borne, vertical, sexual. Okay, needle stick injury, IVDA, all the history will be there. Okay, they are causing fecal-oral. This is the major difference. We'll discuss HBV. Hepatitis B virus பொறுத்தவரை there are 3 antigens. Okay, HBS antigen, HBE antigen, HBC antigen. What are the significance of HBS antigen? HBS antigen, they are called as surface antigens. Okay, or envelope antigen. So it is the first marker to be elevated after infection. It is seen in case, carrier, incubation period, எல்லா ஸ்டேஜ்லயுமே இருக்கும். That is why we have put up HBS antigen as a serological marker. இப்போ ஒரு patient நம்ம hepatitis suspect பண்ணாலும் what immediately we do HBS antigen test பண்ணுங்க. So that is why, because it is seen in all stages of the disease, case, carrier, incubation period. Okay. The next E antigen means E antigen serum la irundale high viral load, high viral transmission. அப்ப அவங்க கிட்ட இருந்து ஈஸியா ஒருத்தவங்களுக்கு transmitted because they have a lot of load. Another one is they are active infection, which means they need to start treatment, right? Indicates poor prognosis. Okay, they are in a bad stage. HBC antigen never appear in serum. What are antibodies? Antibodies are exactly opposite to what we studied, discussed just now. That is, first antibody which will be elevated is anti-HBC IgM antibody. Okay, again same. First and மொத்த markers-ல first வருது S antigen. Antibodies-ல first வருது C antigen. C antigens, if you look at the antigen list, C antigen will never be in serum. Okay. So again, IgM indicates acute infection. Okay. In acute infection la இருக்கும், cases la இருக்கலாம், carrier stage la இருக்கலாம், incubation period la இருக்கலாம் patient. Okay, again எல்லா ஸ்டேஜ்லயுமே இருக்கும். Next, இதே IgG, anti HBC IgG இருந்துச்சுன்னா chronic infection. Is it clear? The next marker is anti-HBE oda antibody. CSCC. When we study antibody, you should study in a reverse order. CES, anti-HBS antibody. Okay. E antibody means what we studied for antigen: high viral load, high transmission, active infection, poor prognosis. Exactly opposite. Low viral load, low transmission, low replication, means inactive infection, but still infection is there, which means what? Low viral load, low transmission because of antiviral response. That sounds good, right? Good response, good prognosis. Okay, but still continue the treatment. Remember, S antibody is the last antibody appears and dissolves the S antigen. S antigen body la irundale infection present. எப்போ இது போகும்? S antibody once they appears, it clears out all the antigen, which means recovery. Or followed vaccination. We all have taken vaccine, right? Anti-HBs vaccines. So which means we are in our serum, anti-HBs antibody will be there. Okay. Patient வந்து recover ஆனவங்களுக்கு antibody இருக்கும். But how to differentiate? Patient serum ஐயும் vaccinated people ஐயும் எப்படி differentiate பண்ணுவோம்? Vaccinated peopleக்கு only anti-HBs antibody will be elevated. Titer will be seen, right? Patient serum evidence of infection வந்துட்டு போன evidence இருக்கும், right? That is called anti-HBc antibody or E antibody or S antibody. எல்லாமே உங்களுக்கு இருக்கும். Okay, this is how we can differentiate from our serum and patient serum. Okay, so whatever cases, it will be given in a case format and you have to identify. Okay, early infection, late infection, and the madrila. Okay, for example, early acute infection means infection இருக்குனாலே அவங்களுக்கு HBs antigen இருக்கும், right? And early அப்படினா anti HBc IgM இருக்கும், right? இது ரெண்டு மார்க்கர் தான் இருக்கும். For example, I put up the case scenario like that. Okay, HBs antigen, HBe antigen, anti HBc IgM, anti HBc IgG, anti HBe IgG, anti HBs IgG. Okay, we'll discuss first for early acute infection. அப்படி இருக்கு அப்படின்னா infection இருந்தாலே S antigen இருக்கும், right? Acute இருந்தாலே I said IgM means acute, IgG means chronic. Earlier இருக்கு அவங்களுக்கு எந்த ஸ்டேஜ்ல வேணா இருக்கலாம், E இருக்கலாம் இல்லாம இருக்கலாம். E indicates high load, அவ்வளவுதான். Rest of the thing are minus. Okay, next scenario, acute infection, acute hepatitis plus high viral load. Acute infection, IgM will be there. Infection, S should be there. High viral load, E should be there, right? இதெல்லாமே tick. Rest of the thing can be minus. Is it clear? இதே active hepatitis plus low viral load. Hepatitis, yes antigen, yes should be there. Active, yes, E should be there. Low viral load. Low viral load means இப்பதான் இது start ஆகுது. Okay, next is called IgM பத்தி தெரியல. Okay, it is cori and this is minus. If I change the word, this is inactive means IgE வந்துருச்சு. Infection means yes, it is there. Okay, regarding like that. Okay, next வந்து இப்ப இது active, chronic inactive means I can put IgGHC. இதெல்லாம் minus தான் இருக்கும். இதே acute inactive means infection is there, yes. Inactive means yes, E inactive. Acute means yes, M. Sorry, inactive means இது E ஓடது. Chronic means this one. Other things will be minus. இப்போ anti-HBs antibody மட்டும்தான் இருக்கு அப்படின்னா rest of the things are minus, means recovery or vaccination. Okay, this is how we need to identify the markers and with the conditions. Okay, next is called HCV. HCV, the questions will be more complications. Among the hepatitis lay, more complications is seen with HCV, and the complications are cryoglobulinemia, glomerulonephritis. Okay, this was a question. Glomerulonephritis and arthritis. More complications will be there. Okay, symptomatic on and more chronic. Yeah, another question. More chronic. C for chronic and complication. You can remember like that. And then HIV. Regarding HIV, 3 antigens again are there. GAG, Paul, envelope. 3 antigens are there. 2 types are there, 1 and 2. One la vandu M type is most common, another subtype is C is most common. Okay, and 4 stages. What are the 4 stages of HIV? That is asymptomatic stage, acute stage, acute flu-like stage. Another one is latent stage. Okay, another one is opportunistic infection, advanced stage. Then last is death. These are the main stages of HIV. Okay, and two classifications, CDC classification and WHO. CDC classification based on CD4 count, and WHO classification based on the clinical classification, that is stage 1, usually asymptomatic fever with progressive generalized lymphadenopathy. Okay, and the stage 2 will be fever, yes, weight loss more than 10%, yes, plus all superficial infections like skin, hair, nail, in the marila or stage 2. Stage 3 on the fever plus yes, weight loss plus yes, diarrhea, unexplained diarrhea will be there for more than even 1 month, plus the superficial side, right here, mucosal involvement, oral mucosa, esophageal mucosa, oral hairy leukoplakia, okay, like that, and TB, LRI. Here URI will be there, here LRI infections will be there. And then type 4, AIDS, advanced stage or opportunistic infections. Okay, this is WHO classification. Regarding lab diagnosis, yes, you will get more questions regarding lab diagnosis. Screening test, most commonly used screening test is rapid CAR test or ICT, chromatography test, and ELISA. Okay, the advanced is 4th generation ELISA. 4th generation ELISA detects both P24 antigen and as well as antibodies. Okay, this is question. And most confirmatory test, most commonly done confirmatory tests are, yes, always P24 antigen can be detected, and molecular RNA. Okay, RNA, viral RNA can be detected. In case of pediatrics age group, proviral DNA by PCR can be done. Okay, this will be your question. Pediatric proviral PCR. Okay, and what are the non-specific tests? Non-specific test means CD4, CD8 count can be done. Neopterin is a and beta-2 microglobulin can be done. Okay, and another important question is window period. What is the test can be done in window period? Okay, window period na எப்போ சீக்கிரமா நம்ம கண்டுபிடிக்கிறோமோ அந்த ஸ்டேஜ் வரைக்கும் தான் window period. If we perform RT-PCR, day 10 to day 14 ல detect பண்ணலாம். Okay, as early as possible. If we perform ELISA ல வந்து especially just now I said 4th generation ELISA ல day 12, day 26 ல detect பண்ணலாம். If we perform ELISA card test 3rd generation ELISA na 3 to 12 weeks ஆகும், which means 1 month. Okay, so this is late. So என்ன test use பண்றோமோ அதை பொறுத்து அந்த window period. Okay, next treatment response, treatment monitoring கண்டுபிடிக்கிறதுக்கு PCR is the best for assessing the viral load. Okay, that's all about the virology. Next, the last part is immunology. So regarding immunology, you should know two things. One is antigen, another one is antibody. Okay, what is antigen? Antigen abina, they should have two property: antigenicity property and immunogenicity property. Okay, antigenicity property, immunogenicity property. ரெண்டுமே இருந்தா தான் antigen-ஆல fulfill ஆக முடியும். Only if it combines with antibody, immune response starts. Okay, what is hapten? Hapten means incomplete antigen is called hapten. Adjuvant means enhances the immunogenicity property. Hapten-ஆல antigenicity மட்டும்தான் இருக்குமே ஒழிய immunogenicity property இருக்காது. What is antigenicity? It just binds with the antibody. Immunogenicity na induces the immune response. Means ஏதோ cell mediated humoral immunity நடந்திருக்கணும். That is called immunogenicity. The response வந்தாதான் that is complete, fulfilled, right? Whereas hapten-னால response கொடுக்க முடியாது. But adjuvant is, what is adjuvant means? It can enhances the immunogenicity. Okay, and what is self antigen? These are types. What is self antigen? Acts against the host. That is called self antigen. It plays a role in autoimmunity. Okay. What is foreign antigen? Foreign antigen means heteroantigen, isoantigen, alloantigen. Hetero means different species. வேற ஒரு ஸ்பீஷஸ், நம்ம ஹியூமன்ஸ், டாக்ஸ், அந்த மாதிரி வேற வேற ஸ்பீஷஸ். ஐசோ மீன்ஸ் சேம் ஸ்பீஷஸ். அல்லோ மீன்ஸ் சேம் ஸ்பீஷஸ், ஸ்பீஷஸ் ஸ்பெசிஃபிக்கா இருக்கும். ஐசோ மீன்ஸ் யூனிக் டு ஸ்பீஷஸ். எக்ஸாம்பிள் ஏபிஓ குரூப்பிங் அந்த மாதிரி. ஓகே, தட் இஸ் கால்ட் ஐசோ ஆன்டிஜன். Another type is called T dependent, T independent antigen. T dependent antigens are of usually proteins. T independents are of usually capsule, polysaccharide. ஒரு ஆர்கானிசம் எடுத்துக்கிட்டோம்னா they have protein, they have capsule, polysaccharide, they have flagella. இது மாதிரி நிறைய parts are there, right? Among them, protein act as a dependent antigen, which means they activate they are thymus dependent. T means T, thymus, D means dependent. Thymus dependent. அதனால அது பேர் இது thymus independent. Okay, thymus independent. They are thymus dependent. They activates this protein antigen activates only mature B cell. Okay, here it activates both mature and immature B cell. Okay, both mature and immature B cell. அப்ப ரெண்டு B cell activate ஆறப்ப என்ன ஆகும்னா polyclonal activation நடக்கும். Polyclonal activation means more number of IgM தான் இருக்கும். Here specific antibodies will be there. Specific antibodies produce ஆகுறப்ப memory antibodies are possible. ஒரு டைம் இன்ஃபெக்ஷன் வந்திருக்குன்னா செகண்ட் டைம் என்ன இன்ஃபெக்ஷன் வந்துன்ற மெமரிஸ் இருக்கும். But here memories antibodies are not possible. No memory antibodies. Okay, this is the difference between protein and capsule. Okay, next is called, that is why all capsular vaccines ellame protein oda combine panni da conjugate panni da we have to give. Example pneumococcal, meningococcal, Hib, I said previously, right? Cannot be, they all are example of capsule. Capsular vaccines thaniya kudutona memory antibodies varadu. Our aim is to create memory antibody. Whenever infection orappo vaccine kudutha adu antibody produce pannum. Adukkaga da we are combining with proteins. Okay, the next is called super antigens. What is super antigen? Usually, what is a real classical pathway? Antigen enter ஆச்சுன்னா antigen presenting cell உள்ள எடுத்து it is going to present via class to MHC molecule வழியா T helper cell கொடுக்கும். Okay, this stimulates the B cell and an antibodies produce ஆகும். But in the super antigen இருக்கு இல்லையா, super antigen is a very, they have extra power, super power. They go directly bind with the T cell, bypassing the APC, bypassing the APC. அப்ப என்ன ஆகும், டைரக்டா T cell bind ஆகுறனால T cell cannot understand what is the exact antigen enter, so they activate more B cell. More B cell வரப்போ actually B cell மேல என்ன இருக்குன்னா IgM is there, IgD is there. D has no role, inert, leave it. IgM, so more B cell வரப்ப more IgM இருக்கும். More IgM இருக்கப்போ shock, more cytokines release ஆகும். cytokine storm சொல்லுவாங்க. So shock, DIC, death இந்த மாதிரி features தான் வரும். Okay, அதனாலதான் super antigens எல்லாமே more severe இருக்கும். Okay, because they bypass the APC pathway. Actual antigen is the real pathway. Will be taken up by the antigen presenting cell and processed by the T cell present B cell stimulation antibody response. Okay, that's all about antigens. We'll move on about antibodies. Antibodies nale 5 types are there. Among them IgM. IgM பொறுத்தவரை they are high molecular weight, maximum coefficient sediment. Okay, that and all okay. What is the significance? Acute infections la elevate ஆயிருக்கும். Number 1. Number 2, fetal immunity. I said right previously, or congenital infections எல்லாத்துலயுமே IgM பாப்பாங்க. Okay, amniotic fluid ல IgM பார்க்கலாம், பேபி பிறந்ததுக்கு அப்புறம் IgM பார்க்கலாம். Usually after up to 18 months அப்புறம் தான் நம்ம வந்து congenital பேபிக்கு ரியலா வந்திருக்கா maternally transferred antibodies செக் பண்ணுவோம். Until that IgM will be very helpful to rule out whether it is congenital or not. Okay, fetal immunity, and then it helps for agglutination. Okay, next is called IgG. IgG பொறுத்தவரை chronic infection. Okay, another one is co-agglutination. Another one is crosses the placenta. If mother is infected with some infection and she developed IgG once vandale she is protective, and the IgG has the ability to cross the placenta valiya poi baby ku poidum. and then baby will become protective. Okay, if the organism placenta valiya pochuna, baby organism varum, baby IgM varum, baby IgG varum, which means the baby will be in acute infection. IgG vandichina, that the baby is protective. Okay, that is why crosses the placenta. Next, complement fixation. Complement factors kuda fix panna help pannu. That is IgG. Okay, next is IgA. IgA can be in monomer form or dimer form. Dimer, question is dimer form is secretory form. Okay, secretory form na eppadi irukum? This is dimer form and this is the secretory component, both linked by J chain. This secretory component irukku illaya, this secretory component is all secretions. It is rich in all secretions: respiratory tract, genital tract, GIT. Predominantly in the GIT lumen la irundha varum. Okay, so if the IgGA is deficient, they will be end up in recurrent respiratory tract infection, GIT infections, GUT infections. Okay, next is called IgE. IgE is the only heat stable antibody, rest all heat labile, responsible for type 1 hypersensitivity reaction, and another H is Helminth. 2H hypersensitivity and Helminth infections elevator. Okay, so far we finished normal antibody. What are abnormal antibody? Abnormal antibodies are light chain elevator. That is Benz Jones protein. Heavy chain elevator da nariya irundhuchu. Heavy chain, excess heavy chain means Seligman's disease. Okay, IgM excess irundhuchna Waldenstrom macroglobulinemia. Okay, the next is called artificial antibody. So if we finish normal, we finished abnormal. What is artificial antibodies? Artificial antibodies means monoclonal antibodies. Okay, monoclonal antibodies particularly produced against, it can be created against particular strain, whatever you want to decide. That is called monoclonal antibodies. Okay, it is usually prepared by hybridoma technique. Other question, hybridoma technique. Next is called antigen antibody reaction. What are the antigen antibody reaction? First one is precipitation. Precipitation example is Ascaris thermoprecipitation, Bacillin, Bacillus anthracis. Okay, the next is called flocculation. Flocculation. Flocculation is slide flocculation test is RPR, VDRL. Is the previous question. Okay, next is called agglutination. Agglutination, slide agglutination is blood grouping, cross matching. Tube agglutination is Vidal Sat. Okay, the next is called heterophil agglutination test. Already we finished. That is Wheel Felix, Paul Bunnell test, cold agglutination, CAT, for mycoplasma, infectious mononucleosis, rickettsia. Okay, the next is called passive agglutination test. Passive agglutination means we are using some carriers. It can be latex, it can be RBCs. Latex agglutination test is nothing but CRP, RF, ASO and all. RBCs use panni panna heme agglutination test. Okay, that is Koncpt test. Next is called neutralization test. Neutralization test apina example is Nagler's reaction, Clostridium perfringens kapanu illaya. The next is called ELISA, newer test. It's so far what we discussed is older test. Newer test is ELISA. ELISA, two types are there. One is called direct ELISA, the other one is indirect ELISA. Direct ELISA sandwich principle. Okay, what is direct means antigen detect pandrom. Antigen detect pandrona well is coated with antibody. Antigen sample larko, திருப்பி ஒரு antibody will be added. So antigen is present between two antibody. This is sandwich principle. Indirect ELISA means antibody detection. Okay, the next is called ELISpot. ELISpot is a mini ELISA madri. ELISpot. This is done to detect the IGRAS, immunoglobulin. Sorry, interferon gamma release assay. Interferon gamma release assay. Okay. And then flow cytometry is another advanced method. Flow cytometry is done to cell count, done to do this, assess the cell count. For example, CD4, CD8 count and all. And then Western blot protein antibodies to check the proteins, especially antibodies specific break பண்ணி அதுல இருக்க proteins detect பண்ணுவாங்க. And then point of care, rapid test. Okay, அதுல என்ன இருக்குன்னா ரெண்டு இருக்கு. Lateral flow assay, flow through assay. Lateral flow assay is called HBV. Flow through assay is done for HIV and HCV. Okay, the next is antigen antibody reaction is over. Then what is immunity? Immunity அப்படின்னா என்ன? First, it can be of two types, innate, acquired. Innate means by birth, right from the birth நம்ம கூட இருக்கும். Okay, they are always non-specific. என்ன organism உள்ள வந்தாலும் our host will react. அதான், that is innate. Acquired means specific. What is acquired? Again divided into active and passive. Okay, active means natural, again divided into natural, artificial. Active immunity na natural route la vandalum artificial route na they stimulate our immunity actively. That is, natural means immunity develops after infection. Artificial means after vaccination. Okay, passive means again passive la natural, artificial. Natural la passive podu. Okay, that is by from mother to fetus. Active means direct administration of immunoglobulins. Those who are completely immunocompromised, அவங்களுக்கு டைரக்டா நம்ம immunoglobulins கொடுக்கிறோம். That is called passive கொடுக்கிறோம், artificial கொடுக்கிறோம். Not natural way. Natural way after infection or after vaccination. Okay, next is called immune response. What is immune response? How does our host react? That is called immune response. Primary, secondary. Primary means first time after infection. Secondary means further reinfection அப்போலாம் வரதுதான் secondary infection, secondary immune response. Primary immune response will be slow-ஆ இருக்கும், sluggish-ஆ இருக்கும், short-lived-ஆ இருக்கும். Usually என்ன antibody வரும்னா IgM antibody, low titer-ஆ இருக்கும். Okay, here reinfection அப்போ வரும் secondary response. It will be prompt-ஆ இருக்கும், powerful-ஆ இருக்கும், progressive in nature. Prolonged, sorry, not progressive, prolonged. ரொம்ப நாளைக்கு இருக்கும். அது என்ன நேச்சர்? IgG தான் நம்ம பாடியில ரொம்ப நாள் இருக்கும். யூஸ்வலா ஒரு இன்ஃபெக்ஷன் வந்தா ஆன்டிஜன் இருக்கும், ஆன்டிஜன் ஃபாலோட் பை IgM இருந்தாலே அக்யூட் இன்ஃபெக்ஷன், IgM switch over to IgG. IgG லைஃப் லாங் பர்சிஸ்ட் ஆகும். ஆர் ரொம்ப நாள் after many years it may come down to this low level titer, but IgG persists for lifelong. Okay, the persist. Usually IgG titer and high titer will be there, high titer. Another one is they are protective. Okay. Next is called cells. Immunology, what are the cells are involved? One is T cell, another one is B cell, then NK cell. T cells la T helper cell, cytotoxic T cells. Okay, T helper cells la T helper 1, T helper 2 and T helper 17 will be there. Okay, cytotoxic T cells are usually of CD8 process. They have CD8 receptors. This is CD4 receptors are. Okay, B cells are nothing but plasma cells. B cells develop into plasma cells and memory cells. Okay, this antibodies kudukrada plasma cells. NK cells are otherwise called large granular cells. That NK cells solvanga. Okay, they also usually in the CD8 they act against virus, tumor, transplant. Okay, in all such conditions it kills the affected cell. That's cytotoxic cell involved cell will be damaged. Usually NK cell ka the mechanism work. Okay, so next is called what you have to know is called MHC, major histocompatibility complex. What is MHC? It is otherwise called as HLA, human leukocyte antigen. இந்த காம்ப்ளெக்ஸ் ஃபர்ஸ்ட் நம்மளோட எல்லா செல்ஸும் பட் லியூகோசைட்ஸ்ல தான் ஃபர்ஸ்ட் கண்டுபிடிச்சாங்க. ஸோ அதனால அது பேர் HLA அப்படின்னு நேம், இட் வாஸ் நேம்ட் அஸ் HLA. ஓகே, this MHC1 which determines the graft accept பண்ணணுமா ரிஜெக்ட் பண்ணணுமா பாடியில. once the graft is placed, whether the graft should be accepted or rejected inside the host அப்படின்னு டிசைட் பண்றதே MHC தான். ஓகே, so this determines the, again the HLA genes இருக்கு இல்லைங்களா, அதுதான் வந்து determines the compatibility. அந்த கிராஃப்ட் ஒத்து போகுது, compatibility. இவங்களுக்கு தூக்கி இவங்களுக்கு ரெசிபியன்ட் டோனார் மேட்சிங் பார்க்கறதே இந்த HLA genes தான். ஸோ அதனால தான் prior to any transplant HLA gene typing should be done by genotypic method. Okay, histocompatibility between the graft and the host. Two types are there, MHC1, MHC2. Okay, MHC1 and MHC2. MHC1 in all nucleated cells la irukum. MHC2 will be all antigen presenting cells will be there. Okay, especially macrophage. Macrophage மேல MHC2 தான் இருக்கு usually. And HLA related disease னு பார்த்தோம் அப்படின்னா வந்து B27ல வந்து ankylosing spondylitis. Patient presents with ankylosing spondylitis. Okay, Rhesus disease இதெல்லாம் வரும். And cytokines, cells we finished. Next, the cell and the secrete ஆகுறதா cytokines. So what are cytokines? Important cytokines only I'm going to tell. Interleukin 1 secreted by APC. What is APC? Antigen presenting cell, that is macrophage. Interleukin 2, T helper 1. Interleukin 4, T helper 2. Interleukin 5, T helper 2. Interleukin 17 is a question, neutrophil. Okay. Again, among the interferons, the question asked was from gamma. Interferon gamma enga varuduna macrophage. Okay, interferon gamma macrophage. Next is called immune response, humoral and cell mediated immunity. Humoral na antibodies, cell mediated means provides immunity against the virus infected cell, tumor, just now we saw, transplant, type 4 hypersensitivity. Okay, and graft versus host reaction. In the ella condition lame cell mediated immunity irukum, whereas extracellular antigens ellathileme antibodies will be elevated. Okay, so what is the pathway? What is the normal immune response? Eppadi nadakuna, for example, this is antigens. Okay, black color is the antigen. Antigen ulla varappo நம்மளோட ஆன்டிஜன் presenting செல் APC, which means I said macrophage. அதை எடுத்துட்டு macrophage மேலதான் என்ன இருக்கும், class 2 MHC இருக்கும். Just now we discussed class 1 will be there in all nucleated cells, class 2 will be in APCs. Okay, so APC மேல இருக்க class 2 வந்து இந்த once the antigen உள்ள வந்ததுக்கு it's broken down, இந்த antigen எடுத்து it will just showcase to T helper cell. Okay, T helper T helper cell க்கு கொடுக்கும். T helper cell மேல என்ன இருக்கு, CD4 receptor இருக்கு. Okay, this bond or T helper 2. Okay, usually அதுக்கப்புறம் B cell will be stimulated and antibodies will be produced. இதுதான் யூசுவலா நடக்கிறது. Okay, T helper 1, T helper 2, T helper 1 இருந்துச்சுன்னா it secretes interleukin 2, interferon gamma, TNF beta. The question வந்து இதான் கேட்பாங்க. T helper 1 secretes what? T helper 2 secretes interleukin 4, 5, 6, 10. 2, 4 secrete பண்ணும், 1, 2 secrete பண்ணும். This will be your question. Okay, that's all. Next is what is complement. Complement அப்படின்னா 3 pathways are there. Classical, in short I will tell you, classical mannose binding pathway, alternate pathway. Okay, classical pathway means C1 is the starting one. C1, C4, C2 will be the initial complement factors. Instead of C1, MBL, MASP binding protein, C4, C2 will be there. alternate pathway வந்து C3 தான் starting, C1 இருக்காது, 4 இருக்காது. Next factors are factors B, factors D and properdin factor. Okay, the question. Alternate pathway, what are the factors involved in alternate pathway? All these three will go and convert the C3 to C3A, C3B. Okay, then C3B will come. C3B will come and convert the C5A into C5A, C5B will be there. And then C6, C7, C8, C9 will come and bind. Okay, so ultimately C5B, 6, 7, 8, 9 is the membrane attack complex. It is responsible for membrane attack complex. Okay, now what are the deficiencies may happen? The C1 இருக்கு இல்லைங்களா, C1 esterase inhibitor. This actually keeps the complement pathway in a mute state. அது நார்மலா மியூட்ல தான் இருக்கணும். Only if there is infection occurs, antigen antibody reaction occurs, complement pathway starts. Otherwise it should not happen. If the C esterase inhibitor is not there, if it is not regulated, it ends up in hereditary angionuretic edema. Okay, hereditary angionuretic edema. If the C2 is not there, see C2 இல்ல அப்படினா இது என்டையரா நடக்காது. அப்ப அல்ட்லாஸ்டா membrane attack complex இருக்காது. So that is why all pyogenic infections will be there. Okay, and especially MAC நடக்கலனா especially Neisseria infections will occur. Okay, so that's all. And then next is called hypersensitivity. Hypersensitivity type 1, type 2, type 3, type 4 are there. Type 1 is nothing but anaphylactic, immediate hypersensitivity. The last is called delayed hypersensitivity. The second one is called cell mediated complement mechanism. இப்ப படிச்ச complement pathway இங்க நடக்கும். 3 is called immune complex. Okay, so what happens in 1? Type 1 hypersensitivity la source of இது வந்து allergens வந்து exogenous, வெளியிருந்து வரும். Okay, remember it is exogenous, whereas like food, dust, drugs, plants, insect bites, wasps, etc. Okay, and most common affects mast cell. IgE, antibody elevate ஆகிறது வந்து IgE. Okay, and then most common chemical mediator is called histamine. Most common clinical features பார்த்தா atopy, local இருந்த atopy, anaphylaxis, systemic இருந்த anaphylaxis. Okay. Okay, nowadays the RIST and RAST. Okay, 2 tests are available, RIST and RAST. RIST means immunosorbent, radio immunosorbent assay. So total IgE elevate ஆயிருக்கான்னு சொல்லும். Whereas allergen specific means என்ன allergenக்கு அந்த IgE elevate ஆயிருக்கு. This is allergen specific. So you may get question in this. RIST and RAST is done for assessing the IgE, that is type 1 hypersensitivity. Okay, next is called type 2 hypersensitivity. Type 2 la வந்து source is endogenous. For example, once a drug is taken, the drug will come and induce the drug induced hemolytic anemia. Okay, once a blood transfusion or ABO incompatibility occurs, that blood group antigens will come and induce. Okay, blood group antigens. So இதெல்லாம் antigens தானே. Okay, RBC க்கு மேல இருக்கிற antigens. இந்த antigens here antigen is fixed. Okay, antibody will come, whereas here antibody is fixed on the mast cell. IgE is fixed on the mast cell. Here it is ulta. Okay, the next thing is the mechanism of killing is antigen and antibody complement mediated. Okay, complement mediated lysis. Next, type 3 hypersensitivity. In type 3 hypersensitivity, that is immune complex deposition, antigen antibody deposition ஆயிடும். If the antigen antibody deposition is small, it will be travel to the entire system throughout the vessels, right? Yes, that is generalized. இது வந்து if the antigen antibody is large இருந்துச்சுன்னா large size na deposit side. So localized, large size on that gets localized, right? Localized means that is called Arthus reaction. Arthus. If it is generalized means serum sickness. Okay, all hypersensitive immune complex mediated is type 3 hypersensitivity. Then type 4 hypersensitivity is called delayed type. Okay, delayed type hypersensitivity, and it is cell mediated. The first three will be antibody mediated, here cell mediated, that is CD4 T cells will be there and antigen will be there. APC is taken up, presented to T helper cells, and T helper cells will decide whether it is T helper 1 or 2, mostly T helper 1. T helper cell 1 secretes the interferon gamma and interleukin 2. They act on the macrophage. Macrophage, more number of macrophage will cause caseous necrosis, granuloma, all cellular damage occurs. Okay, so this is how it becomes example of TB and skin test. Okay, type 1 lepra reaction, contact dermatitis. Okay, so that's all about the hypersensitivity reaction. The next is called immunodeficiency. Immunodeficiency means, first, let us see one by one. First, we'll discuss B cell. First, hematopoietic stem cell. From there, pro B cell will arise, and the pro B cell, pre B cell lahum. Pre B cell, immature B cell. Immature B cell will become mature B cell. Mature B cell develops into either plasma or memory B cell. Plasma cell or memory B cell. Plasma cell and antibodies. Okay, this is a usual pathway. If the failure of conversion of pro to pre B cell occurs, this is called X-linked A gamma globulinemia. Okay, up to here, heavy chain. Here, heavy chain rearrangements nadakku. Here, light chain rearrangements nadakku. Okay, from here, it happens in the bone marrow. Usually, B cells arises in the bone marrow, but matures in the bone marrow. Okay, IgM will be elevated because heavy chain disease. Okay, it's not exactly IgM. It is called heavy chain accumulation. Okay, this conversion is usually helped by Bruton tyrosine kinase enzyme. If the enzyme is deficient, conversion is not there. So this will be a question. Okay, so which means what? Antibodies are not produced, recurrent infections will be there. Okay, the next thing is, if there is a failure of conversion of plasma cell to antibodies, this is called CVID, common variable immunodeficiency syndrome. Okay, so what happens? All IgM will be excessed. Okay, next is called, if there is a conversion of, if there is a failure of conversion of mature to this is called CVID. Okay, antibodies la IgM to IgG switch over nadaklana IgM disease, hyper IgM, this is called CVID. Next is called T cell. T cell deficiency la, the classical example is DGeorge syndrome. DGeorge syndrome means chromosome 22q11.2 deletion. Okay, which means what? It helps for actually development of thymus, parathyroid, heart, face lower part. Okay, and then behavior. If there is any deletion in this chromosome, it doesn't allow the part to develop, right? Thymus means T cell will be depleted. Parathyroid hypocalcemia, decreased parathyroid. Heart on the TOI tetralogy of Fallot, face on the cleft palate. So these are the features of DGeorge syndrome. Okay, next is called chronic mucocutaneous candidiasis. Again, recurrent candidal infection, skin infections will be there. So that's all about the immunodeficiency. And the last part is transplantation, transplant immunity. Transplant immunity பொறுத்தவரை rejection, this will be the major one, rejection or graft versus host reaction. Okay, rejection means 3 types are there. This is question, hyperacute was asked once. Hyperacute, acute, chronic. So what is the mechanism of hyperacute rejection? Hyperacute means immediately, even in the table itself, that is due to preformed anti-ABO or anti-HLA antibodies. Anti-donor antibodies already அவங்களுக்கு இருக்கும். Acute means within weeks to months. Okay, graft oda antigen will react with the host oda antibody. Okay, and then antigen antibody complex, complement mediation, complement activation, இதுக்கெல்லாம் டைம் எடுத்துக்கும். Okay, or இது ஒரு mechanism, or CD8 வந்து lysis பண்ணி விட்டுரும், cell lysis. Chronic means always CD8 will be ready to cause. Okay, so this is the mechanism of rejection. Graft versus host reaction அப்படின்னா graft produces the immune, the graft உள்ள வச்ச graft, for example kidney, liver, இது வந்து இருக்கிற ஹோஸ்டுக்கு against act ஆயிடும். Okay, எப்போ அப்படின்னா only in case of immunity is low, immunocompromised conditions, the graft produces immune response against the recipient. Okay, this happens when the immune or recipient oda immune status is completely suppressed and the condition. Okay, then the last is called autoimmunity. Autoimmunity means usually you and I will not develop autoimmunity. When it happens, when the self antigens are allowed to survive inside the blood. Okay, usually it will not be allowed, it will be neglected or deleted by receptor editing mechanism and all. இது வந்து சென்ட்ரல்லே நடக்கும், சென்ட்ரல் சிஸ்டம் during developmentல நடந்துரும். If there is a failure of this receptor editing deletion in the central tolerance இல்லனா, that is called peripheral tolerance. Peripheralலே ஒரு சான்ஸ் நம்ம ஹோஸ்ட் கொடுக்கும். Okay, நம்ம பாடி, that is called ignorance. அப்படியே செல்ஃப் ரியாக்டிவ் ஆன்டிஜன்ஸ் ரியாக்ட் பண்ணாலும் first they'll try to ignore. If not, எனர்ஜினா co-stimulatory signal இருக்காது. For example, T helper cellum MHC2 molecule bind ஆகும் இல்லையா, அந்த co-stimulatory signal will not happen. And then skewing, phenotypic skewing. What is phenotypic skewing means? Non-specific cytokines. For example, interleukin 1 வரதுக்கு பதிலா interleukin 2 வரும், which means what? The reaction will not develop. Okay, these are all some protective mechanism will happen in the host against the autoimmune disorders. If everything, central tolerance and peripheral tolerance fails, patient may develop autoimmune diseases. Okay, so I think I've finished the entire microbiology. If you have any doubts, you can ask. My small tip to prepare is always be thorough with the classification. So once you are thorough with the classification, definitely microbiology will be the easiest one. Okay, because concepts are very simple and less when compared with other subjects. Okay.